Hello, 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 my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, January 24th. Can you believe how quickly this month has gone already? And it is time for another National IC Support Group meeting. Now, the purpose of my doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I want you to be active, informed. I want you to take control of your doctor's appointments. I want you to be able to have skills to deal with critics and all those things. And so, how do we do that? We do that with information, we do that with education, we do that with empowerment, we do that with confidence. Now, listen, IC doesn't scare me anymore. Back when I was first diagnosed with IC, yeah, man, it was rough. The pain was real. Anybody who says the bladder can't hurt, I got to tell you, I remember one of the most tragic cases that I worked with early on was a mother who had two young daughters who had IC. They both had really bad bladder pain. And one of them couldn't even go to school. I'm going to say they were like fourth grade and sixth grade, right? And um, one was able to go to school, the other was not able to go to school. And the one thing she was saying is the doctors didn't believe that her children were in pain and they wouldn't help them with pain management. And she found the daughter who was stuck at home praying to God to help her. And it was tragic. Hello, Elizabeth. It's nice to see you. And so we worked together for quite some time over the phone, and I gave her as many tips as hints as I could. I tried to connect her with Dr. George Schuster, who at that time was the only doctor working with children with IC. Of course, this was quite some time ago. He's long retired. But it was a very, very powerful moment for me. And so ironically, at the same time, I was scheduled to go to my very first National Institutes of Health IC meeting. So here we've got the top IC researchers in the world, the top clinicians in the world in the room, right? And we had a speaker, and I do believe that it was Dr. Schuster at the time, who actually from the podium said, children don't feel pain. Children don't feel bladder pain. And I was stunned. Here we have the top researcher in the world, supposedly for children, who didn't believe that children hurt. And so now remember, y'all, I got to understand at that time I had pretty severe IC. I was not confident at that point in time, but what I was completely outraged. And so I was the first person to the microphone to ask a question. And I told the story of the little girls, one of whom was praying to God to help her with the pain. And I said, that is absolutely not true. Children absolutely can feel pain. They deserve our compassion. They deserve our treatment. They deserve all of that. And I was just shaking in my boots, at National Institutes of Health meeting. It's like, okay, at that point in time, somebody needed to fight. I'm a fighter. I'm going to fight for you guys. And, he was like, well, I kind of disagree. I don't think children feel pain and yada, yada, yada. And I go back to my seat. The doctor immediately behind me, Dr. Lowell Parsons, said, Jill is absolutely right. Absolutely, children feel pain. Yeah, Elise says that's not true. As a pediatric nurse, I know children, also very premature babies, feel pain. And I think that that's really the problem here is when you have an issue on the inside that's not visible to the naked eye, it's really easy for people to discount it. It's very, very easy for people to discount it. And remember, doctors, to a certain degree, and Elise, you can help me with this. Elise is watching on YouTube right now, is that in many cases, doctors are taught to diagnose through observation, right? So concept number one is, what does the patient look like? Well, I look like I've got a pelvic pain. Do I look like I've ever suffered with pain so bad that I just literally didn't want to be here? And the answer is no, you can't see injury from the inside. You cannot see bladder injuries. You cannot see pelvic floor injuries. But the other thing we have to remember is that doctors also use their own experiences. And if that doctor's never had severe bladder pain or pelvic pain, their ability to understand the severity of your pain is different. They're like, oh, come on, it's a UTI. Everybody can handle a UTI. You're just going to take some Azo. No, 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 no. That there are moments when pain, especially organ pain, from the C fiber in the bladder, the worst thing you can do to a hollow organ is stretch it, right? So if your stomach gets overly full, that hurts like hell. If your bladder gets overly full, yeah, that hurts like hell. But if the person has never been there, if the person has never experienced it, it's very, very hard for them to understand what you are going through. And so I kind of have a rule that let me just share this thing that I think that's really, really useful um, to use when you are talking with a doctor about your pain. And that is, you never ever walk in and say you want pain medicine. You have to walk in and you've got to share how your life is disrupted because of the pain, how your functions have changed. So instead of going, "Hey doc, I'm in pain, I need pain meds," you got to say, "Okay, doc, listen, the pain is so severe, I can't work. The pain is so severe, I can't sit in the car, drive in the car without screaming when I hit a bump," which is how I was my first year. Um, "Doctor, the pain is so severe, I can't sit through church. I can't shop. I can't do my laundry." And then the question is, what can we do to restore my ability to function? I need to be able to dress my children for school. I need to be able to fix their food. How can we fix this? How can we improve my functionality? And they go, maybe a little bit of pain therapy would be useful for you. Now, obviously, clearly, I'm talking about oral medication, right? Like Vicodin, Norco, things like that. And if you look at the American Urology Association guidelines for IC, they are incredibly aggressive about pain management. They want your pain to be treated. They tell doctors at every single appointment that they are supposed to ask about your pain level. And they support the use of opiate medication. But they also believe in multimodal therapy, and so do I. What does that mean? It's like, hey, man, we're not just going to treat the pain. We got to figure out what the hell the pain's coming from, right? So, if, for example, your pain is coming from super, super, super tight muscles, well, dang, come on now. The most important thing for you to do is to relax those muscles, right? We got to deal with the muscle issue that's going on. And that means you're going to be stretching and you're going to be working with a physical therapist, and you're probably going to be using muscle relaxants like Flexeril or Baclofen or vaginal Valium suppositories. And that's why when you look at our flare management guide and you look at our hour by hour rescue plan for flares, you will see a very big difference between bladder wall flares and pelvic floor flares, because the pelvic floor flares, our number one job is to get these muscles to release. Okay. But for some of you, the reason you are in long-term agonizing pain is because you have Hunner's lesions. Hunner's lesions are wounds on the bladder wall. They are open wounds. And if you have an open wound in your bladder, as your bladder fills with urine, urine gets inside of the wound and it hurts like hell. But here's the thing about Hunner's lesions. They respond beautifully to therapy. 85% of the time, if you get your Hunner's lesions treated, your pain goes away. The problem is that there are doctors out there who will diagnose a lesion, but they won't treat them. And again, that goes against the American Urology Guidelines for IC. The American Urology Guidelines for IC are really, really crystal clear. And that is, when you find a lesion, you treat it. You treat it with lesion-specific therapy. You cauterize it. You inject it with a steroid. We have Liris, which is unfortunately not available right now. That heals lesions in 2 weeks. And so the other thing that the American Urology Association Guidelines for IC says is, if you're getting worse rather than better, if you're not responding to therapy, if your pain levels are off the chart, for God's sake, take a step back and let's try to figure this out. What did we miss? What did we miss? They asked the doctor and they asked the patient to take a step back and let's reconsider this diagnosis here. Maybe we didn't get it right. Maybe we missed something. Do you, for example, have a fibroid tumor pushing on your bladder? That would hurt. Do you have endometriosis? That would hurt. Do you have a Tarlov cyst? It's a little cyst of spinal fluid that comes off the lower spinal cord. That would hurt. Do you have a previous injury? Do you have a crooked tailbone? There are lots of things that can trigger pain. And until we understand your unique mystery, yeah, you got to get through the day. You got to deal with the pain while you can. But fundamentally, you also have to be asking, what is causing this pain? Please help me understand what is triggering this pain. Now, y'all know, if you've attended any of my meetings before, that I don't like guessing. I like facts. And there comes a point in time where you have to let the doctor look. You have to let them look. If you've been in pain for 6 months, 3 months, 6 weeks, and you're 100% convinced it's your bladder because it's hurting when you're peeing, and of course it might not be your bladder, there comes a point in time when it is important that you let a doctor look. Otherwise, you're forcing them to guess, and you deserve more than a guess. You need facts. You need facts. So, the pain is real. Seriously, I've been there. I get it. I had begged God in the middle of the night to please fix this for me in my entire first year. We didn't know back then is that the great majority of my pain is not coming from my bladder. It was coming from my pelvic floor muscles. And it took us about 10 years to figure that out. I have another very interesting story of a patient who was afraid to have a cystoscopy to let a doctor look inside your bladder. There are two different methods that they can do that. They can do a plain cysto. I call it a looky-loo. It's a 5-minute test. They just numb your urethra, stick a scope in, look around, pull it out, bam, you're done. You're done. And that lets them look for gross abnormalities. It lets them look for big things. I've had 2 of them. I mean, seriously, I'm not lying. If my doctor called me and said, hey, man, I want to look in your bladder today, I'd say, what time? I'm not worried about a cysto. The challenge with a cysto is that your urethra gets irritated for a couple of days, but after that, it should be fine. And that's just giving them an opportunity to look at your bladder. And for God's sake, if it's hurting, let them look at some point in time. So with this one patient, was totally afraid to have any testing, and she wouldn't do any testing at all. Years go by, she's in agony, and finally one day, 5 years later, she's like, okay, you can look. What did they find? He did a cysto. What did he find? A giant kidney stone. Kidney stones or bladder stones are sharp. They have big, sharp edges. And so here this poor woman had floating in her bladder a sharp crystal that was cutting her bladder wall 24 hours a day. It was just floating in the urine, cutting wherever it was finding. And as soon as they removed the kidney stone, what do you think happened? Healed. So she let her fear stop her. She suffered for years unnecessarily. If she had just had a cystoscopy in those first 3 months, she would not have gone through what she's been through. So at some point in time, you have to let them look. A hydrodistension is a whole nother story, because with a hydrodistension, it's an outpatient procedure. They do it in the operating room. You're under anesthetic, and they fill your bladder with fluid, and they drain it out, and they fill your bladder with fluid, and then they drain it out again. And then they take a close look. And because that stretches your bladder, that absolutely can cause more pain and discomfort. And so hydrodistensions now are only done, again, according to the American Urology Association, if the diagnosis is in doubt. That many patients are diagnosed by exclusion. All right, hold on one sec, guys. I need a quick second. I hear somebody calling me. Hold on. All right, sorry about that. As y'all know, I care for a 98-year-old, and my mother's going to be 92 in 2 weeks. So always got to put them first. All righty then. So I hope that that helps you understand a little bit about kind of my approach to this, and that is number one, IC doesn't scare me. Number two, if I'm in pain, if my pain has lasted for a period of time, I want the doctor to look at it. I don't want guessing anymore, which is why I had my 2 front teeth root canal, because they started hurting about 6 weeks ago, and in fact, they were fractured. Um, and when we are managing pain, we also want to try to understand the source of the pain. If that pain has been unremitted for a period of time, if it's getting worse rather than better, the American Urology Association is crystal clear. Let's take a step back, make sure we haven't missed something. All righty. All righty. Somebody's saying, how do I get to the Zoom link in this meeting? I will post it, but the other way to get to the Zoom meeting is to go over to our main website. Here, hold on. Let me move my computer here. All right. icnetwork.org, icnetwork.org. If you go to the support pull-down menu, you'll see the second link down there, Stream Support Group Meetings, and you will then see the link to the Zoom chat. Okay. We normally do this in 3 ways. We do, I usually start with some sort of educational information. Then I take questions. Then I will start the Zoom meeting where you can come in and ask questions. And then we will come back to Facebook and YouTube. We are broadcasting live right now on Facebook and YouTube. Please understand that when we go into the Zoom meeting, Facebook and YouTube will hear you, but they will not see you. We do not publish the Zoom meetings. Okay. I mean, so people can see them, but they will hear you. So, you know, if I ask you a question that might be a little bit on the embarrassing side, you can say, I'd prefer not to answer that question, and that's fine. All righty. Hello, Deb from snowy, chilly Canada. Hey, man, we are expecting 5 days of heavy rain. And so they're already telling us our power is going to go out. It's ridiculous. All right. Hello, Donna. It's so nice to see you. Hello, Elise. We don't have vaginal Valium in Norway. Sad about that, since I have so many bladder spasms. Okay, but Elise, you're missing the point here. There are 2 different types of muscles in your pelvis: smooth muscle of your bladder and striated skeletal muscle of your pelvic floor. And they respond to different medications. So if you're having bladder spasms, you would not be using the Valium for that or the baclofen for that. You would be using oxybutynin. You would be using a smooth muscle relaxant, ditropan, Detrol. And I'm sure you can get ditropan or Detrol, something like that, in Norway. But the skeletal muscle relaxants will only work with the pelvic floor muscles. The smooth muscle relaxants will work to calm bladder spasms. And let's just describe a bladder spasm for a moment. I've only had severe bladder spasms once in my life. Praise God. Praise God, knock on wood. It happened when I had what I thought was a flare for 6 weeks, beat the hell out of me, finally went to the doctor, and the doctor goes, Jill, you're not having a flare. You got a wicked infection here. And I was stunned. And what was happening was that every time I went to the bathroom, as the last couple of drops were coming out of my urethra, I would get it's like my bladder walls would contract really hard. And I would have this kind of violent wave of pain that moved up my spine and down my legs. And so when you have bladder spasms, man, you're on the toilet and you're just going, oh my God. Right. And you're just like sitting like this for a couple of minutes while you're waiting for the spasm to go away. Oxybutynin, ditropan, will turn those spasms off in about 20 minutes. The challenge with oxybutynin, and it's something that many doctors will immediately give to patients, is that you're not meant to take it for a long period of time. And I remember when I was first diagnosed, I took it for about 3 months. And what happened is it slowly kind of deadened the smooth muscle of the bladder, and it got to the point where I really was having trouble peeing. And so, you know, you really want to pee, but you can't, because those muscles are all kind of deadened from the medication. And so what I found for me personally is that I only used the medication when I was actually having bladder spasms. Now, there's something else that's kind of funky, and that is, do you ever feel a fluttering or a vibration in your pelvis? Sit up. You ever feel movement down there? Like your bladder is fluttering? Well, sometimes that's actually muscle, a skeletal muscle instead. Let's see. Elise says, but if they looked at the bladder 1.5 years ago without seeing something, they didn't take a biopsy. Now they want to do a new cystoscopy. I'm so unsure. Well, listen, guys, if they look in your bladder and they see nothing, that is fantastic. It's not just, I know that you think it's your bladder. You are 100% sure it's your bladder. When they look at your bladder and they go, there's nothing wrong, it's like, okay, then what the hell's causing my issue? And that's when we look outside of the bladder for something else that might be involved, like your pelvic floor, like endometriosis, et cetera, et cetera. Hello, Leanne. Leanne asks the question, what is your opinion on InterStim? InterStim is a step 4 treatment option by the American Urology Association. It uses an electrical impulse to kind of re-regulate the nerves of the urinary tract and the bladder. InterStim was invented here in Northern California back in the early 1990s when I started my support group. Thus, my support group was filled with early InterStim patients. And let me tell you, there was nothing good about it back then at all. These patients were extremely traumatized because they didn't believe in using anesthesia during the trial. And so there was lots of screaming and bloody murder about InterStim back then. Obviously, times have changed. The device has changed. The people involved have changed. They've gotten better. InterStim is, in fact, a viable way to kind of normalize nerve function if you have a nerve issue. It was originally improved for incontinence, and it can be life-changing if you're incontinent, especially if you're stool incontinent, fecally incontinent. Man, InterStim can change that person's life. But InterStim is not approved for pain management, nor is it specifically approved for interstitial cystitis. Fundamentally, we have to weigh the pros versus the cons, the risks versus the benefits. And there are substantial risks with InterStim. There are thousands of adverse events reported with InterStim to the National Institutes of Health. And if you go to the MAUDE database, Google MAUDE, MAUDE, FDA database. That is the FDA database that tracks adverse events with medical devices. And you will find thousands and thousands of adverse events reported with InterStim, the most common being deep tissue MRSA infection, the device breaking, the device shocking patients because it moves, and even fatalities associated with InterStim. The last time I counted, which was several years ago, I found 19 fatalities that were associated with InterStim. One very interesting one where somebody's heart started beating in time with the InterStim device. So, most patients don't go to InterStim right away. Most patients instead will do the ankle stimulation known as the Staller afferent nerve stimulator, or SANS, or urgent PC, or post-tibial nerve stimulation. There's a whole bunch of gobbledygook for you. Basically, what that does is it doesn't require surgery. Instead, they go to the same nerve they're treating up in the sacrum. They hit it where it's the closest to the surface of the skin, which is by the ankle. And I was an early urgent PC SANS patient. It was invented by Dr. Marshall Staller at UC San Francisco. And so let me see if I can show you let's see. Okay, I have tattoos where they put the needles. And I'll tell you, listen, it broke me out of a year-long flare. Okay, I have to contort. Can y'all see the little spot right here? See the little black spot right there? That is a tattoo where they put the needle in to access that same tibial nerve. And so it's basically 3 finger widths above your ankle bone right here. And then it's about 1 finger width below median, right? And then when they put the needle in, the needle doesn't go straight in. You have to finesse it. So you kind of tilt the needle down. And anyway, the advantage of this is, number one, very, very, very few adverse events. If you go to the MOD database and you look for urgent PC, the last time I looked, there were two adverse events as compared to thousands. The other big issue is it's cheaper. The other big issue is you can potentially do it from home if they teach you how to do it. The thing about nerve stimulation that's really important is it should never hurt, right? And so if they're doing it, so basically all you do is you take your shoes off, you pull your pants up, the basic, your lower pant up, you know what I mean? And you're just going to basically sit in the Indian position if you can on a table. And what Dr. Stoller did for me is they just put acupuncture needles on both sides. And then they attached a TENS unit to it. And whichever needle was the best placed is the one they used. And they knew it was placed correctly if when they turned it on, your big toe bent down and your outer toe splayed out. So that's how we knew if we got the needle in exactly the right position. And then they turn the stimulator on. It should never hurt. They will get to the point where it hurts a little bit. You tell them, they back it right back down. It's on for 20 minutes, and that's it, once a week. It requires no surgery. It's just piece of cake. The other thing about InterStim that really, really concerns me is the fact that some patients have been charged a massive amount of money. So I've told this story before of a nurse who lived in a small town on the East Coast, Appalachia somewhere. There were 3 urologists in town. All 3 of them said, your next bet is InterStim. She didn't want to do it, but she felt like she was forced to do it. And so, but she was pretty smart. So she's extremely smart. She talked to the urologist billing office and said, is this covered by my insurance? And they said, yes, absolutely. No pre-authorization is required. She called the hospital where she worked, where she was going to have it done, and talked to their billing department and said, is this covered by my insurance? And they said, yes, absolutely. No worries. No written pre-authorization is required. And then she called the insurance company directly just to verify, is this covered by my insurance? And they said, yes, absolutely, 100%. No written pre-authorization is required. She had it done. A week later, she had a bill for $80,000. And a threat to garnish her wages. And she's like, wait, you all told me. You told me this was covered. I can't afford $80,000. No way. The mistake she made is she didn't get it in writing. Y'all got to get it in writing. So if anybody's saying do InterStim, don't just say yes, it's covered. You get it in writing. You get it in writing from the insurance company and from everybody. Don't just assume. Okay? So I'm not a fan of InterStim. I'm not. And the company knows that. I challenged them years ago. They even sent one of their vice presidents out to talk to me like 20 years ago. Why are you against InterStim? And I said, I'll tell you why. Because y'all aren't given anesthesia during the trials, and you should hear the patients crying in my support group meetings. For God's sake, give them anesthesia, which they started doing. Hello, Debbie from Gulf Shores. Aaron says, start a new digestive enzymes and hurting bad. Any thoughts? Well, if they're hurting bad, I would back off. It's kind of trial and error. Maybe you did too much. Maybe there's something else in it that could be irritating you. Did a doctor tell you to do them? Or are you just doing them? So look at the ingredients. Make sure there isn't something funky in there. Maybe back off for a couple of days. Call your doctor, let him know it hurts. Well, normally what a doctor would say at that point in time is back off for a couple of days and then try a small dose. Maybe. You guys, listen, I'm not a doctor. I can't give you medical advice here. You should not interpret anything I'm saying here as medical advice. My job is to educate you and then kick you in the butt and get you back to your doctor. That's my job. Okay. And okay, you guys on Facebook, please remember it scrolls by so quickly. I miss stuff. And so Anne says no pain. So what is it? I don't understand context because it scrolled back. So please ask that again. Pamela says, going to another new OBGYN. My vulvodynia doctor is done after vulva biopsy in March 2020. I had squamous cells removed. I have irritation, burning at the opening, vulvar inside. Did a urine test, culture, no infection, had tons of cream. had installation suppositories. I've hurt for 18 years. All right, so Pamela, um, so vulvodynia, for anybody who doesn't know what vulvodynia is, I had vulvodynia in my 20s. So vulvodynia feels like you have a yeast infection, but they can't find anything. And for me, the only way I could describe it is it felt like somebody had rubbed sandpaper all over my vulva. It was that bad. It was so bad. And so assumption number one is, and we have to try to consider what could be causing this. Of course, the first thing we want to do is rule out some sort of infection. A lot of you guess and you think it's yeast and you buy over-the-counter yeast medications. They don't work, and that's because it's for many patients has nothing to do with yeast or infection. The second thing we want to do, Pamela, is look at the quality and health of your skin. Do you have estrogen atrophy? Is your skin dry? And is that why it's so sensitive? And the third thing we want to look at is your pelvic floor muscles. Because if your pelvic floor muscles are tight immediately above it and restricting blood flow, it could be an ischemia situation. Pelvic floor physical therapy actually helps vulvodynia tremendously for many patients. Think of vulvodynia, in Dr. Weiss's book, Ending let's see, hold on, let me get it. Breaking Through Chronic Pelvic Pain. Hey, and y'all, hey, listen, if I've in one of these meetings said that I was going to send you something and you never got it from me, I know one person I said I was going to give this book to, but I didn't get the email. I have to have an email with an address. So please call me on it. Send me an email, icnetwork@mac.com, or call the IC Network office and talk to the corporate line, which is the line I usually answer. And I will make sure you get what I promised you I will send you. But a lot of times I just don't get the emails. I mean, it happens, I got to say, a lot. Like 2 weeks ago, I think it was 2 weeks ago, I was supposed to send this book out. Okay, so anyway, in this book, Breaking Through Chronic Pelvic Pain, Dr. Jerome Weiss is the guy who became an expert at muscles and nerves. And he believed that a lot more people had nerve problems than they realized. And so he always, in addition to evaluating the bladder and evaluating the pelvic floor, he also evaluated the skin for signs of nerve issues. Vulvodynia is kind of a sign that the nerves of your vulva are involved. And that's just what he did. The other thing that's important to know about vulvodynia is if you have a lot of pain by your perineum, which is that little bundle of skin between your urethra and your vagina and your rectum for a woman, or for a man between your rectum and your testicles, there's that like inch or two of skin that's super, super sensitive. And the reason why it's super, super sensitive is because immediately above the perineum is, in fact, if you can see this diagram right here, do you see that little spot right there? That's called the perineal body. And look at the muscles that attach to the perineal body. So one of the reasons why the perineum gets so painful is because the muscles that attach to the perineal body are involved. Muscle, muscle, muscle. Okay, and again, Facebook, please ask it again. It's just, you guys are flying. You're talking so much. Wow. Normally, streamers have a separate window which shows all their chats. I don't have that. Any information you can share regarding a UTI of Aerococcus following an ablation procedure for Hunner's lesions, having a hard time kicking it after 7 days of antibiotics. So the risk of any sort of procedure that goes into your bladder is that they can push bacteria up inside of your bladder and give you a bladder infection. They would normally do antibiotic sensitivity testing to verify the type of infection you have and the correct antibiotic to treat it, or do a next generation test. I would suggest a next generation DNA urine test. Pamela says, I've been told I'm a mental case by urologists. I was in tears, had so many dismiss me. They say, let's see, I was told from the wonderful Alabama doctor, they were taught that it was all in people's heads. Yes, that's true. So Pamela says she's done physical therapy for 13 years. It hasn't helped yet. So Pamela, then we got to take a step back and say, okay, if you've had physical therapy for years. And if your muscles are healthy and the physical therapist says your muscles are healthy, then we all got to take a step back and ask, okay, what else could be triggering this? Could it be endo? Kathy says, getting ready for a COVID vaccine since I'm 70. Awesome. Good job. Patty says, the other day I was in the ER and they asked my pain on a scale of 1 to 10. I told them 100. I get it. Kathy says, I'm afraid of flares. Have you had problems with this? Hun, listen, I haven't had anybody who's had a vaccine call me and say they flared from the vaccine shot. I've had plenty of patients with COVID who have called with terrible symptoms that we're doing the COVID IC study. I'd much prefer the lower risk of the vaccine than having a wicked flare because I now have COVID virus in my bladder. So I wouldn't worry about that too much. But, talk to your doctor. But again, I haven't had anybody call me personally to say they flared after having a COVID vaccine. Kirsten said, I'm using Flexeril. Valley suppositories, installations, finally feeling somewhat normal, but at the same time scared to get back to normal life, like sex and stuff, scared of that trigger and not getting back under control. Well, hun, I totally get that. And I have a really good section on our website about intimacy and trying to engage in intimacy again. Number one, y'all have to understand that your partner is not going to figure this out for you. This is something you've got to figure out on your own. You've got to figure out what hurts and what doesn't hurt and build some trust in your body again. And so I'm not going to say more about that because we're streaming and it's getting into very intimate issues, but go on over to icnetwork.org and go into our sex and intimacy area, okay? All right. Now, what is going? Now I'm not. Oh, here we go. Pamela says, how did they do a vaginal MRI? You're in an MRI machine, but the MRI is really good for visualizing bony structures. And, they don't normally do an MRI for your bladder. Phoebe said, did I get a TENS machine? Yes, they gave me a TENS machine. I have a TENS machine. I ran out of needles, not the TENS machine. They just did the right settings. Debbie said, I had a fulguration for my Hunter's lesions last August, and I'm now pain-free, except for a little pain when peeing. Yeah, baby. Woohoo! Very tolerable after years of having pain all the time. It was because of you, Jill, who gave me courage to have it. Oh, Debbie, I'm so happy, hon. I'm so, so happy for you. Kristen says, yeah, I had that forever. Then the first pee in the morning hurt. I also added Benadryl, hydroxyzine. Barbie's asking about good doctors in Kansas City. We have a database on our website. Just go to our database, put your zip code in, and that'll help you. I don't have one. I want to, looks like there's a name. I'll try to remember this name. A name immediately came up for Kansas in my brain. Oh my God, he speaks a lot at AUA. What the hell is his name? Look at the universities, hun. Look at he's affiliated with university. Annie says I look good in purple. Thank you. Okay, you guys, I put this shirt on. I'm just gonna tell you right now, like I put this shirt on again. The last time I wore this shirt streaming was the night the fire burned through my town, my neighborhood. And I was a little intimidated, but I kind of, there's a good luck, bad luck thing that sometimes goes in my brain. And I have to say, I was a little scared. But anyway, now they're telling us about to watch for flooding. Hello, John from Wisconsin. Oh, you guys, you know what? Look at that. I didn't even put up my background. Well, darn it. Here, hold on. There. Now you have a background for me. And I would like to thank the sponsors for this meeting, Preleaf. Preleaf is the oldest supplement on the market today. It's been used for about 30 years. It reduces acid level in foods. So if you got to go to grandma's house and eat her lasagna and you're worried that that's going to hurt you, taking 1 or 2 Preleaf before that meal might help. Of course, you do not do this like candy. If you do a lot of Preleaf over time, then you're going to get excess calcium in your bloodstream and potentially start throwing kidney stones. So just follow the directions. But this is tried and true, tested. It's been around for decades. Alrighty then. Belinda says, I've been suffering since you were 5 years old. I have a UTI, kidney infections, went to the doctor's urologist, told my mom it was in my head. I used to be Wonder Woman. Now I'm so bad I can't do crap. I'm in bed most days. I'm 56. When I'm bad, I feel like I'm in labor. Okay, so Belinda, have you had your pelvic floor muscles checked? Um, you know, when symptoms begin in childhood, there are a couple of really logical things that we look for first. For example, one of my members also had symptoms from childhood, stunning symptoms from her childhood. And then when she was a bit, she went to school, she went to college, became a teacher, but was always struggling with icy symptoms, really severe icy symptoms. And then one day she just became incontinent and she had a prolapse. But when they went in and did the surgery, they found that she actually had a birth defect. And it was the birth defect that created the entire foundation for years and years of suffering with her. And so we want to look at are there any structural abnormalities in your pelvis, any structural abnormalities in your hips or your spine or your knees or your leg or your legs or your feet. If one of my clients has a club foot and she has never walked normally and her muscles are really screwed up, and as long as she's in a very difficult situation because they can't fix her club foot, and creating a shoe that will adapt to that is just very, very difficult. So she's always dealing with very, very tight muscles. And we would also want to look at traumatic injury. So I've worked with some people who've been hit by cars, so they've suffered bad falls, something like that. But several, maybe 4 or 5 patients over the years who were hit by cars and had a broken hip or broken pelvis from being hit by a car. So Belinda, I would love to talk to you, and if you want to give me a phone call this week, not tomorrow, but from Tuesday on. Just go over to the IC Network, icnetwork.org. Phone numbers across the top of the page, phone numbers here on Facebook. I'd love to talk to you a little bit more about that, hon. Donna says, I was doing good. I was doing pelvic floor stretches for 8 months, doing great. On no meds, all of a sudden, bam, the IC was back. Went to my urologist. She didn't find anything new. Went to my gynecologist. She found a polyp on my cervix, which ended up being cancer. Hey, girl, just like me a couple years ago. You had a total hysterectomy. My question is, would that polyp cause the IC to come back? No, the polyp really is not going to have any direct effect on the bladder unless you have cancer that has spread, right? If the cancer has spread throughout your pelvis, then there is a chance, yes, that it could also affect your bladder. But usually the biggest challenge is recovering from the hysterectomy. That when you have a hysterectomy, especially a total hysterectomy, we got you're being hit in 2 ways. Number one, you're being put into menopause immediately. And your bladder needs estrogen. When your bladder doesn't get estrogen, it can't protect itself as well. But the other issue is the actual trauma, the physical trauma of the surgery. They're not lying when they say it takes a year to recover from hysterectomy. It took me a year. Many of you were here when I was going through that. It was very difficult. And I had terrible pelvic floor muscle spasms. The spasms at the vaginal apex, so the very top of the vagina where the incision was, right below where my cervix was. Man, holy hell, was that painful. It's better now, but it took a lot of physical therapy. I couldn't do physical therapy for about 10 months. I was like, nobody, no, you're not touching me. I was in so much pain. It's like, no. It took about 10 months for me to let somebody do internal work down there. And all it took was just 3 visits to physical therapist and it resolved it. Ms. Up All Night. I love your name, Ms. Up All Damn Night. She diagnosed with IC, had it since the 80s, still have very bad pain, even with acupuncture. So again, we have to understand where your pain is coming from. Is it coming from your bladder wall or your pelvic floor or something else? Do you know? Do you know your IC subtype? Hello, Kayla from Greenville, South Carolina. Aaron says, can digestive enzymes cause a flare? Not normally. Not normally, unless there's something in there that you're reacting to, a preservative or something. Hello, Carol from Cold, Massachusetts. My doctor, Kayla says, yes, I felt that. My doctor prescribed vaginal Valium suppositories to help with the bladder spasms and pelvic floor. I had the Axonics bladder stimulator put in back in July. I was out for both therapies. Both surgeries, it really helped so much with the incontinence and the urgency. Good job. Christina says, I had an internstim for 2 years. It did not help and it caused me pain. Christina, I hope you had it removed. You know, guys, the longer interstim is, the harder it is to get out because scar tissue develops around the leads. So if interstim is not working for you, get that sucker out. You don't want it in because then you can't have an MRI. All right, Ms. Up All Damn Night says both. All right, so what was the shape of your pelvic floor, hun? Is it tight? What'd they find? And did you have physical therapy? Heather says, I have a new pelvic problem that is destroying my pelvic PT, urogynecologist, or rheumatologist for loss. I'm waking up with orgasm-like feeling that turns into spasms all the way up under my ribs and back. You get Botox in your levator ani, obturator, pelvic floor, and compounded depositories. Well, hun, it sounds like you've got persistent genital arousal disorder, also known as PGAD. I call it one of the dirty secrets of IC or pelvic pain, because when patients have it, they often don't tell anybody out of embarrassment. The last thing you want to tell your doctor is, hey, you're kind of getting a little pleasure out of the pain, which is exactly what's not happening. What happens is the pudendal nerve gets compressed and traumatized by the pelvic floor. And that is manifested with this feeling of like slight arousal combined with really icky pain, also known as persistent genital arousal disorder. It happened to me for a couple of weeks early on, and it was creepy. I did not like it at all. And so the fact that you're having that tells us that your pudendal nerve is compromised in some way. And normally what they would do is a nerve block. So Heather, please Google PGAD, persistent genital arousal disorder. And it is, again, the result of the pudendal nerve being compromised in some way. The question is did it happen after Botox? Are you still doing your physical therapy? Have your muscles gotten tight again? That's what I would be looking at. Arlene said you had months of the tibial nerve stimulation and then a trial of interstim. Neither helped. Okay. Hey, man, you gave it the good try. Good for you. Those are step 4 treatment options. But again, guys, understand here that we haven't thought of IC as an incurable bladder disease in a decade. Since 2008. In 2008, the first research study produced by the National Institutes of Health proved that pelvic floor muscle therapy outperformed bladder therapies 2-to-1. And when that happened, basically the IC world was turned on its head because up to that point, everybody's going bladder, 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 bladder. But here we have a very clear, reputable study that says, but muscle therapy helps? Huh? Maybe IC just isn't a bladder disorder. Maybe there are other things beyond the bladder that can be causing this constellation of symptoms. And we now realize and understand that the bladder basically is often a victim of something else happening in the pelvis. A lot of it has to do with shared nerve pathways. And so if you, for example, as you go through your day, you feel like you're carrying a bowling ball around in your pelvis and it gets heavier and heavier and heavier. Well, that's probably pelvic congestion syndrome, also known as varicose veins in your pelvis. And that is very easily treatable. We have a whole list of confusable conditions over on our website, icnetwork.org. Just built a whole new section on that. So you just got to work through this stuff. Could it be this? Could it be A, B, C, D, E, F, G? Got to rule all that stuff out. And for many of you, listen, you've been on bladder therapies for years and they're not helping. Okay, if the bladder therapies aren't helping, the odds are it's not a bladder problem. The odds are something else is going on. And I just kind of want to say that what's interesting to me is there are a number of patients who are sent to pelvic floor physical therapy. They're told their muscles are tight, but they just walk away. And it's very frustrating. It's very frustrating to me because, listen, a bladder treatment isn't going to get your muscles healthy. And the problem is if you've got super, super, super tight muscles, the consequence of that is reduced blood flow to the bladder, reduced blood flow to the vagina, reduced blood flow to the vulva, reduced blood flow to the rectum, et cetera, et cetera. And we're also dealing with now nerves that can't function normally because they don't have good blood supply. And so our therapeutic priority for these patients is to restore blood supply. If your symptoms began after a fall, a car accident, et cetera, et cetera, et cetera, et cetera, we have to do things that will restore blood supply. And that ultimately is going to be pelvic floor. Rock Me Art says, I'm waiting on host to Zoom. Question, would you get a microplastic if you have IC? No, it's not a treatment for IC. Absolutely not. Microplastic is a bulking agent that they use in the urethra for people who are incontinent. That's not a therapy for IC. No way, in no way, shape, or form. And my concern about it too is that I don't believe that it's reversible. I don't think so. Listen, I'm not an expert in macroplastic at all. If you're incontinent, we want to try to understand why you're incontinent. Is it a nerve dysfunction or is it muscle weakness? If it's muscle weakness, pelvic floor physical therapy might be able to fix it without you doing another procedure. And I'm not going to start the Zoom meeting for another 25 minutes. Arlene says, I need to talk to Jill sometime. Yeah, please do. Give me a call. You guys, I'm available. Listen, I'm usually on the phone all day, every day with patients. It's first come, first serve. So it's whoever first gets the first phone call back. I often don't start answering the phone until about noon because I've got elder care I've got to deal with first. And I will call late into the night. And so if you leave a message, understand that there's a good chance I will call you back at 8 or 9 o'clock Eastern time because I'm still working then. I will tell you too, patients who pay for coaching always get first priority. So the patients who have a paid coaching session always go to the top of the line first. But I'm here almost every day. Mondays are my day off. So Saturdays and Mondays are my days off, which means I'm doing elder care or cleaning my house. Liz says, April says, can you tell me why I can't take antidepressants without severe retention? I've tried many. I need one that won't cause retention. I don't understand why that would happen, but it's well known. I couldn't take antidepressants either. And I think you're just going to have to maybe talk to your pharmacist first, because there are lots of different classes of antidepressants. And so maybe an anticholinergic medication is not right for you, like Elavil or imipramine or nortriptyline. Maybe you've got to do something that's not an anticholinergic medication. Kathy says, any comments on the COVID vaccine? I think that I fully intend to fully intend to take the COVID vaccine when I can, because what our research study is showing is that 75% of IC patients who get COVID have their symptoms get seriously worse. And some patients who are pain-free and have been flare-free and for remission for years and years go out of remission. And we think that's because the COVID, we know active virus is found in the urine of some IC patients. We know the virus can infect the kidneys. And the assumption here is there a chance that the virus could be infecting the bladder? I don't have any proof that that's happened. That's a guess. But what our study is showing is that for some patients, their bladder symptoms go off the chart. And so I do not want to be in that group, and I fully intend to get the vaccine when I can. And Arlene just says here, I had one vaccine, did not affect my IC at all. Anne says, with IC, do you have nocturia at night? And the answer is yeah, that's common. Patients will often be up and down all night long, especially if your IC subtype 1 and subtype 2, Hunner's lesions and bladder wall driven. Nighttime frequency is often a direct result of irritants that happen during the day. A lot of people say, why is it worse at night? The reason why it's worse at night is because you don't have distractions. So we often will see a worsening of symptoms at night because you had a cup of coffee that morning, something like that, which is why we say don't do coffee. Denise says, I'm 6 weeks post-op for a defective bladder sling. Ew, girl. My body has been going through almost a withdrawal from it. 15 years in, constant IC flare for almost 3 weeks. See doctor Tuesday. I need relief. So, hun, you are having post-surgical pain and trauma, and we have to assume a good portion of that is probably just trauma from the surgery. Anytime you have a pelvic surgery down there, especially surgeries are dealing with slings and lifts and, God forbid, hemorrhoid surgery, man, the pain is real. The pain is real. And so make sure that you write down your symptoms for your doctor and ask yourself, does the pain get worse as your bladder fills with urine? And is it relieved by urination? That would tell us if it's the bladder wall. The other thing, too, that's really important is that sometimes the bladder itself can be perforated in surgery. And so we've had that happen a couple of times where patients have had surgery, and unfortunately a stitch went through the bladder wall. And as long as that stitch is there, that bladder's going to be screaming in pain. And so normally when they do a reconstructive surgery like that, they do a hydrodistension afterwards, very gentle, to look at the bladder to make sure they didn't hurt the bladder in some way. So that's going to be what you're going to ask. Belinda says, has anybody that has IC gotten a hole in their colon? No, not that I'm aware of. David, finally got through to you, but I sent 2 emails before and it seemed like they just disappeared. No, David, I did get this. I did get at least 1 email from you, but remember I have Mondays off and I try not to check that. And then you emailed me again on Tuesday or Wednesday, and I should try to respond to that. And I want to thank you profusely and publicly for offering to buy one of the books for another IC patient. Casey says she had leukocytes positive, nitrates negative today, blood pressure 179 over 190. Girl, woo, that blood pressure. So you were in the emergency room. I hope they were able to get your blood pressure down. You're an Inderal, metronidazole. Hannah, our phone number is right on our website, on our contact page, right at the top of the page on our website. So go on over to our website. But again, remember, I'm not a doctor. I can't give you medical advice. But I mean, I try to give you at least a little bit of context so you can ask good questions of your doctors. Patty said, after being in the ER 3 times, here, hold on a sec. y'all you guys on YouTube, if I'm looking up, I'm looking at Facebook. If I'm looking down, I'm looking at, okay, now I'm looking up at Facebook. Y'all on YouTube, you guys are being very quiet. Is everything okay over here? Feel free to ask questions on YouTube. All right, let me go back to Facebook. Marjan says, good morning from Australia. Good morning and happy summer to you back there. And I hope you haven't been affected by any fires so far this year. Patty says, after being to the ER 3 times in the past 4 months for severe pain during my period, a talk with my urogynecologist ended up with a date set for a hysterectomy, but we tried physical therapy and I did respond. But whenever my period happened, all progress seemed to be lost. Crossing my fingers that hysterectomy will provide some relief. Patty, make sure you go over, there's a fabulous website called hystersisters.com. Go on over there. This is huge population of patient women who have had hysterectomies and who support other patients. And they have a wonderful preparation list and checklist, both before surgery and after surgery. And they've got diaries and they will check in with you. Hyster Sisters is a fabulous, fabulous website. Hello, Mona from Nova Scotia. Pamela said they did the test on my lower back with electrical wires. Her too. It took 2 to get me up off the table. Doctor and lady both said I had fibromyalgia, too much fibromyalgia. Thank you. I do. Okay. Elizabeth says, do you know if bladder builder is a kidney stone contributor? It shouldn't be. I don't believe that there. Let's look at it. Well, it does have calcium in it. Not a lot. It's got 38 milligrams. It's got 38 milligrams of calcium in it, 3%, just 3% of your recommended daily dose. So if you're prone to kidney stones, normally they would have you stop any product that contains calcium, especially something like Pre-Leave. And so you need to show this to your doctor and ask them if that's too much for you. I mean, 3% is pretty tiny. But if you've got a lot of calcium flowing through your bloodstream, you probably don't want any more calcium. Patty says, I passed lots of little kidney stones and have recently started flaring. Do you know if the kidney stones are causing a flare? Yeah, kidney stones. Listen, kidney stones are sharp little crystals and they hurt like hell coming through. And one of the reasons they hurt like hell is because they're cutting. All the little sharp protrusions are cutting the tissue as it's coming out of your body as you're passing them. The other thing we know about kidney stones is that they're covered with bacteria. Just a robust population of bacteria on most kidney stones. Mary's saying something about it helped getting the baseball out of my rectum. Mary, I'd love to hear the context of that. Susie says, the least issues I had with IC was my bladder. Remission since June, and thanks to you and the integrative friends, mast cell, eat low histamine, chiropractor, pelvic floor therapy. Awesome. Love to hear that. Arachme, I don't understand. You're leaking because of lowborn with IC. I don't know what that means. Arlene says, on hydrodistension, my bladder wall looked normal. I had some pelvic PT. Physical therapist said my muscles were slightly tight, but could not recreate my symptoms. Therapy didn't help, but I didn't have that much at all. Tried to do it myself for a while with no results. So I gave up. So again, Arlene, we got to look at other possible contributing factors. Do you have fibroid tumors pushing on your bladder? Do you have Tarlov cysts? Could you have varicose veins in your pelvis that could be causing some of these symptoms? Denise says on YouTube, hey, I'm having a very negative reaction to hydroxyzine causing the bladder spasm, yet I'm having difficulty voiding. I'm in lots of pain while I tried to sleep and you had nightmares. So, hon, you're having, I think, what they call a paradoxical reaction to a medication where you're having the exact opposite of what that medication was intended to do. So rather than helping you sleep, it's actually keeping you up at night. Rather than calming you down, it's actually amping you up. And so, and the number one symptom of hydroxyzine for me was nightmares. And that's why I had to stop it. Hydroxyzine, you guys, is an antihistamine. It is a step 2 treatment option for IC for the bladder wall. Especially, but they're found to be especially helpful for people with a history of allergies. I'm somebody who does have a history of allergies, which is why I started to take it. I took it for 8 or 9 years really successfully. It helped me sleep through the night. It's a little bit harder to wake up when I was taking hydroxyzine, but eventually it gave me night terrors where I was having videos, literally watching my family being eviscerated in front of me, those terrible dreams, terrible night terrors. And I knew as soon as that happened that it was from the hydroxyzine, and that's why I stopped using the hydroxyzine, and the nightmares went away immediately. Haven't had one since. Mary Jones thinks that she has got varicose issues. Well, you have to go to a specific type of, see if your regular doctor will refer you to an interventional radiologist. I think that's what it's called. They're the ones who have the skills to diagnose varicose veins. We'd be reasonable to rule out if you have that bowling ball sensation. Yeah, and I know COVID stopped a lot of appointments for all of us. Arakmi says, I've had IC from birth and had large intestine removed because of Hirschsprungs. I don't know what that is. Had pelvic floor therapy, everything for 60 years. Just had a sister yet again. I want to cure the leakage. You're tired of it. Microplastic is the only thing the doctor offered. Well, I mean, it's certainly, if it, that's not incontinence. That's not IC. Incontinence is incontinence. And so you're not able to hold urine, and for one of two reasons. Either you have nerves that are not functioning normally or muscles that are not functioning normally. And so if the doctor thinks a microplastic is the right thing, then you got to Google it, learn about the pros and cons, and if there's a chance it might help. I mean, it did get approved by the FDA, so I wouldn't rule it out. I mean, you just got to understand what you're using it for. It's not a treatment for IC. It is a treatment for incontinence. Thank you, David. I appreciate that very, very much. Mary Jones says, I have the bowling ball every day. What can I do? Well, you got to get diagnosed, hon. You got to get diagnosed. Marcella says, I had my urodynamics. They said I have overactive bladder because my bladder was a small capacity. So confusing. So urodynamics test is a very interesting test because I've had it done. And what it's doing is it's testing the normal function of your bladder. So you're basically on your back with, in the urologist's office. You have a catheter. They fill your bladder with fluid, and they start asking you questions like, when do you first feel the need to urinate or the sensation of fullness? When do you first feel the urgency? When do you first feel pain? And that will help them understand and try to identify some of the things that could be going on, but it's really not recommended as part of the diagnostic workup of IC. I have a small bladder myself. I always had a small bladder, but I think that's, again, it goes back to kind of childhood injuries and stuff like that, having more sensitive nerves that my bladder just doesn't hold as much, mostly because my nerves are so sensitive. They tell me it's full, even if it's half empty. Kayleen says, thank you so much for the book. This week is my 4th bladder installation, which they really do help better than the meds. It does kind of beat up my urethra, but it's worth it once I heal up after a few days. I have a question. What is the connection between marshmallow and IC? So marshmallow root is an herb that has a calming and soothing effect. And so marshmallow root tea or taking marshmallow capsule. I mean, we sell marshmallow capsules from Douglas Labs in our store, I think. I think we still do. It's viable. It's something we're trying. Our challenge here really is that some people reactive marshmallow. It can be a little bit irritating. Belinda says, hi, Belinda from Florida. Not only do I have IC, but my mother and my niece do. So that's where we're talking about IC subtype 5, central sensitization. This is true in my family, in the sense that, hello, redhead, Norway. My mother has sensitive skin. My grandmother had sensitive skin. My sister has sensitive skin. My cousin has sensitive skin. The inheritance part of this is really about nerve sensitivity, that we are born with a more sensitive nervous system. Thus, we have a more sensitive bladder. We have a more sensitive stomach. We have a more sensitive bowel. We have wicked sense of skin, wicked sensitivity of our skin. But I think the most interesting symptom is a wicked sense of smell. We can smell things that other people can't smell, and smells drive us crazy. That's not a disease. In many cases, that is just how you're born. It's the landscape. It's not a disease process. But living in 2020 with a sensitive body is hard because we are very, very chemically sensitive too. I was never allowed to use bubble bath as a child because we knew from my sister that our skin reacted to bubble bath. I do very poorly around chemicals, very, very poorly. David says, I stopped drinking soda and my kidneys don't stop, but everyone's different. Good point. Mary says, my bladder can hold 1,000 mLs of urine towards the end of the day, but early in the day, it's terribly painful with a small amount, like 30 mLs. I have to really think about that. That's interesting. Kayleen says, is it the visceral that can cause the nightmares? Yes, Kayleen, absolutely. We call them hydroxyzine dreams. Hydroxyzine is the generic name for visceral or atarax. And nightmares and night terrors are a common side effect for some people. It didn't happen for years for me, but when it happened, believe me, they were awful. And so if you're having nightmares while you're taking visceral, you want to tell your doctor about that, and they might have you back off of it for a while. Once a nightmare started, I stopped it. I stopped it. I couldn't watch these videos. I couldn't watch these. They felt like I was living in a nightmare video. It was so bad. Marcella says, any advice about Botox for IC and overactive bladder? That was my next step. Botox is a step 4 treatment option. The American Urology Association has 6 steps of treatment for IC, and they're arranged with respect to the risk of adverse event. So obviously, we don't want you to do stuff that can cause long-term side effects until you do the easy stuff. Botox is in step 4 for a reason. The number 1 side effect of Botox is retention. If they accidentally inject the nerve that controls your ability to pee, you might not be able to pee on your own for a couple of months. You will have to self-catheterize. Botox used to be was originally placed in step 5 because urinary retention was so common. And the Botox should never be done on anybody who is unable to self-catheterize, which is ironic because a lot of people do it on elderly people who simply could not self-catheterize. That said, there's research that shows that it helps, but it comes with risks. Go onto our website and read about it. Beverly says, it's safe to take azo for pain once a day. That's an excellent question for your pharmacist. I can tell you that azo is normally not meant to be taken every day for a long period of time. Lisa says, do you have to have a cystoscopy to be diagnosed with IC? A diagnosis of IC is a diagnosis of exclusion. They rule all the other easy stuff out first, and eventually, if they cannot explain your symptoms, if you don't have a typical UTI or fungal infection, or you don't have something particularly obvious, then that's when they start thinking IC. But normally by that point in time, they will have at least looked in your bladder once, maybe not a hydrodistension, but a cystoscopy. And that would be a correct thing to do to make sure you don't have a bladder stone or something else irritating your bladder. Don't let fear stop you from having a good diagnostic workup. You deserve more than a guess. You need facts. And allowing somebody to look in your bladder, if you've had pain for a period of time or symptoms for a period of time, is the logical thing to do. Mary Jones says, I must cath ever since doing Botox. You can't empty your bladder. Oh man, hon, I'm so sorry to hear that. Yep, that's a reality. That's why it's in step 4, step 5. All right, so, oh my goodness gracious sakes alive. All right, stretch break. All right, guys, let's work it out a little bit. Come on, move a little bit. Move your neck. Stand up, shake it out a little bit. A little stretch. Woo! Yeah. Sitting for a long period of time is rough. Alrighty then. Mary says 200 milligrams of Advil a day too much? I don't know, hun. I haven't looked at the research. Google it. For over-the-counter pain medication, you've got a couple of options. You've got aspirin, but aspirin is salicylic acid. That can be a little irritating to the bladder. You've got Advil, which is known for irritating the stomach, and you've got Tylenol, which is known for irritating the liver. And so you're kind of stuck between a rock and a hard place there. When I was playing tennis and was an athlete in my 20s, I did a lot of Advil. And I will tell you, I eventually kind of blew my stomach out, and I couldn't take it for 20 years. Now I can take it again, but I just switched to Tylenol because it really messed my stomach up. There is now an Advil Tylenol combination, which really surprises me on the market. I don't quite understand that. I think it's baffling. All right, so you guys remember on Facebook, please don't take it personally if I don't answer your question. It just means it flew by my screen. All right, so this is what we're going to do now. We are going to start up the Zoom meeting. And the Zoom meeting is an opportunity for you to come in and talk to me directly and tell your story. But be prepared. I'm going to stop you and start asking you a lot of questions. So you get a little bit of coaching, and you'll have an opportunity to talk to me one-on-one. So let me go ahead. And so the way I start my Zoom meeting is I go over to the IC Network website. Y'all can do this with me, icnetwork.org. And you see our new cover, our new beautiful cover. May we face every day with courage, strength, and confidence. Hashtag no shame, no blame. That is our cover for winter. And you're going to go to the support pull down menu, go to the second link, stream support group meetings. And go to the third link, Zoom meeting. That's what I'm clicking on right now. And since I'm the person I'm going to launch the meeting, and I'm allowing it. All right, come on. Alrighty then. The Zoom meeting is now open. Let me get an invite link, and I will post this invite link also. All right. I'm willing to take questions. If y'all don't want to do Zoom, that's fine with me. We'll come back to this. I'm amazed we have power, because they told us we would probably lose power. So if I disappear suddenly, it means my power got turned off. We have a big storm coming in, that's why. All right, YouTube, you have the invitation. Facebook, you have the invitation. So I'll let you in one at a time in the Zoom meeting. Eric is already in, and so I'm gonna, hello, Eric. Hi, this is Jill. I'm sorry? I'm sorry, hon, I can't hear you at all. Your voice is really messed up. We are live on Facebook right now and on YouTube. Okay? Okay. Okay, that's fine. Go ahead and pop me an email, icnetwork@mac.com, and we'll do it that way, okay? All right. Bye-bye. All right, and let's rock me in, and we're gonna let Raylene in. And guys, hold on. I just need to go get a sweater. It's cold here. I'll be right back. A storm is coming in. All right. Okay, and there's Kayleen. All right, good sir, Eric.
I just have one question.
Okay.
It's nice to see you again. Always appreciate these meetings. So, Joe, last week I was doing fairly decent, although I had let some things get out of control. And since it seems like my stuff is due to overactive nerves, again, it doesn't seem like bladder functional stuff is at issue.
Okay.
I had been off my antidepressants, and my blood sugar had been pretty high over the last few weeks. And so now I've got pelvic floor discomfort in the penis and stuff like that. And actually laying down, it's almost like when I'm up walking around, I'm actually do better than say laying down. Does that give you enough information to say, hey, yeah, that off the antidepressants and stuff? Because the antidepressants usually really keep things humming low.
And why did you go off of them?
Well, I think it was because I was feeling good and started to go, hey, I'm doing good. So
Yeah.
I do feel some shame right now. I want to say that. I do feel some shame.
Oh, come on. No. You don't have to feel shame about anything here. I would suspect that's why you're flaring. I mean, if the antidepressant is working for you, we know that it calms nerves down. And so, have you gone back? Are you on them again?
Yes, I just started them again in the last 3 days, and it usually takes several weeks for them to really
how long were you off?
About 3.5 months, I think.
Oh, wow. Yeah.
And it was funny because I was doing fine, and then all of a sudden, I don't know how to explain it. It just like I got there were real stressful things going on, and like Thursday, I started to feel real queasy. I started dry heaving and stuff like that, and it was just somehow it always seems with the high blood sugar and off the antidepressants, boom, everything's back whack.
Yeah. Is the queasiness gone? You got your blood sugar under control now?
My blood sugar is, I took it today. It was 225, so it's getting down there.
Okay.
But I think it was running really, really high. So
okay.
I was peeing all the time, and the urine was really sticky and stuff like that.
Did you let your doctor know?
Not yet. I'm seeing my doctor tomorrow.
Oh, good. Well, listen, we've all done that. We've all, whether it is eating the wrong food or choosing to stop a medication or choosing to stop physical therapy. Listen, your intentions were honorable. You were doing great. It made sense. And we know that it's nice not to have the side effects for a while, because the challenging thing with the antidepressant is that there are significant side effects: dry mouth, dry eyes, snacking, which does not help. That does not help your blood sugar, and that's the challenge with. Were you taking Elavil, amitriptyline?
I'm taking sertraline and bupropion, so that's Wellbutrin and Zoloft.
Okay. I don't know. Do those have the same side effects?
I don't know, because I couldn't tell. I don't know, because these work really well for me.
Okay.
Sertraline is good for the depression, and I think bupropion is good for the anxiety, because I have a high generalized anxiety disorder. And
Uh-huh.
I can tell that's back today because I just know the signs of it. And I was like, how is it that all of a sudden, I was fine 3 days ago, and all of a sudden now my bladder is achy. I can feel tightness in the abdominal area. You know what I'm saying?
Well, so remember what we talked about with the your brain getting stuck kind of in a fly, and
Hmm.
we all, so many of us struggle with anxiety, and we kind of now know why that happens. So you've got to do things that will try to ease your anxiety a little bit so that that doesn't intensify your pain, right?
Hmm. Um, for me, I try a lot of mindfulness and breathing and stuff like that, but it seems like I still have to use diazepam. Like I had to use it last night to kind of, because I was just feeling so, wired.
Right, right.
So,
And you're not doing any caffeine, nothing like that?
oh, I'm doing tons of caffeine. I guess, does this have caffeine in it?
Dude, what the F?
It's
Wait
gotta
a
be
second.
caffeine. I know. I think I have
Wait,
this. Yeah.
wait
Might not
a
even.
second.
Um,
Okay, why are you doing this?
I think it must be some. I have no idea because I'm like, am I trying to punish myself? I think it. I think. I think when I'm doing really well, I'm like, I don't need all this stuff. I can just. I want to go back to. There's a saying that says a dog returns to its own vomit, and I think I keep going back to my old bad habits, and I don't know why. That's a question for a therapist,
Okay,
probably.
well, so like, listen, seriously, right now, since you're with me, would you please get up and go pour the damn Coke out?
Okay, I will.
No, no, you go do it right now while I can see you, and you bring back the empty bottle, okay? He's doing
Um,
it. Okay, guys,
I'll
hold on a
I'll
second.
say,
Kayleen, don't say anything yet. Let me finish up with him first, okay?
well, I want to tell him something.
Okay. Okay, well, then let's wait for him to get back. So you guys, so I made a mistake there in thinking, all right, Kaylee, okay, so Eric, if it walks like a duck and talks like a duck, it's a duck. So
Yeah,
your first symptom was bladder wall irritation.
yeah.
And you were kind of assuming that it was related to the anxiety and the blood sugar. It's like, we didn't ask the most important thing is, did you eat or drink something that we know is going to irritate the bladder?
And the funny thing is, yeah,
And more importantly, irritate the nerves because caffeine
and
stimulates nerves.
I think it's that combination of things. Now that let's say my nerves aren't as protected from the antidepressants, because that really calms everything down. That really brings everything down, and I feel pretty good at that time.
Mm-hmm.
So now
Mm-hmm.
everything's gotten, and I can tell I've been through this a few times, and I can tell this is exactly the cycle. And
So,
it's just,
so my brother, so just full honesty here, my brother for 20 years was addicted to orange soda,
mhm.
orange soda. And that's pretty much all he drank. He's a physics professor. And watching his body transform was stunning because he got very puffy. Was super cranky, like super, super, super cranky and irritable. And then he finally was diagnosed with diabetes. And the doctor finally had a come to Jesus discussion to him about his soda drinking. And so he's now down to a little tiny soda a day. That's it. That's all he allows himself. And the transformation is nothing short of astonishing. He's just calm again. Now he's a redhead like I'm a redhead, and we already have a really sensitive nervous system. And so hitting that with caffeine every day really amps up everything. But we've all done it, hon.
Mm-hmm.
I just came
Mm-hmm.
up. Listen, I ended up in the ER 2 months ago with my heart racing. Okay, why? Because I had started drinking coffee again. I can do coffee. I can do decaf coffee. I can do like 7 months of it. And slowly my nervous system gets amped up. Everything becomes more sensitive. Bam, I start throwing arrhythmias. The arrhythmias will last for a couple of months. And then it takes a couple of years for everything to calm down again. And then I go right back to the coffee again. You know, it tastes good. That's why they sell it. It tastes good. So you didn't do anything wrong. No shame or blame here. But, you know, we just kind of have to do the, if it walks like a duck and talks like a duck, it's a duck. You're having a bladder wall flare from drinking soda. It's
and
right.
It's also in the urethra and in the penile shaft as well. That's also really irritated.
So I think next week you're not going to do any. So how many sodas have you been drinking a day?
2 or 3.
Okay. So, and do you get headaches when you stop?
No, I don't. I don't have caffeine. I don't get caffeine withdrawal.
All right. I want you to lose the soda for a week and check back next Sunday. I think you're going to be a new man, a better man. You're going to feel better.
All right, I will.
Okay.
I will. Thanks, Jill.
I mean, listen, if you ever need a pep talk, you know who to talk to, because I can give you a pep talk filled with love, but in the same sense, I'm going to kick you in the ass and say, lose the freaking soda. Okay.
Yeah.
And what I'd love for you to do instead is get some of the, because you like sparkly. Okay. So do the LaCroix.
Okay.
Get the berry LaCroix, or the I think it's, see, I like the ones without flavors. I just like the sparkle rather than the flavor. But the berry one's pretty good, and it's pretty bladder friendly. Switch over to that.
Okay.
I mean, that's a hell of a lot better, and let's see how you do. Okay.
Okay. Sounds good.
All right, hon. Listen,
Thanks.
and no shame, no blame here. We all do it. It's a learning curve, and it's easy to forget. And at the same time, sometimes you just want our normalcy, and I totally get it. Okay.
Yeah.
All
Thanks.
right. Big hug to you.
Thanks.
All right. Now, Kayleen wanted to say something. Kayleen, what did you want to say? Kayleen wanted to say something to you.
So I heard that you were taking bupropion, and I'm like, oh, ouch. And then you said that you were drinking, cherry Coke, and I'm like, oh my God. Have you noticed anything like, maybe like getting dizzy, or like, a roller coaster of like high energy and no energy?
A little dizziness now and then, but not, I just was back on this. And I think when I jump back onto the antidepressants and stuff, things get really crazy in your body before they get normalized.
Because bupropion and caffeine do not do well.
Okay.
I
didn't know.
I was working at General Mills, and I had a Pepsi, and then obviously I took the bupropion in the morning, and it's just, I had to go home. I was like I feel high. Like I shouldn't be, I should be considered under the influence. So yeah, it was too much, but I just wanted to know about.
Yeah. No, thank you. Yeah. I think, Jill, quick question for you. The penile urethral kind of stuff, is that just part of the whole amped up nervous system thing too? Is that?
Well, I mean, there are a couple of theories. Sometimes the penile pain is just referred pain. It's just referred down the nerve root from the bladder right down to the tip of the penis. But sometimes it's urethritis, urethral sensitivity. And so we can't rule that out too. I mean, your skin is sensitive. We already know that, but it wouldn't surprise me if the soda was irritating your urethra. Let's just put it that way. 2 ways. You got the acid erosion, and is it diet soda or regular soda?
Diet.
Okay, dude, no, you can't do that. Diet soda, NutraSweet, is metabolized into formic acid. So you've got the citric acid that's used as the flavoring. You got the formic acid, which is the metabolite of the NutraSweet. You get a double whammy of acid erosion with diet sodas. You know, and if you looked at the FDA approval for NutraSweet, you would see the bladder irritation is quite common.
Okay.
Yeah. So, and the other thing to understand too, the other challenge with doing artificial. Here's Lisa saying coffee doesn't bother me, but soda's killing me. Or Sprite, no caffeine. But even then, I only have a couple a week. A 2-liter bottle will last well over 2 weeks. Yeah. I'm gonna say I just got totally distracted here.
NutraSweet, sweeteners, citric acid, the other aciding with the diet sodas.
Right. So let's see. But there was something specific I was gonna say associated with that. It'll come to me. Sorry.
Okay.
That's what happens when I get distracted a little bit. You know, you just understand that soda, you've got a triple whammy. You've got, with a diet soda, you got the acid used in the flavoring, you've got the acid metabolite from the artificial sugar, and then you've got the coloring and the preservatives and everything like that. And if you had an open wound down your hand, would you pour diet soda on it? No. And the thing is I don't remember, did you have Hunter's lesions or anything like that?
No, okay. My bladders always look good.
Okay, so again, you're like my brother here. You're just, you and me, we are siblings in our symptoms. Your bladder's normal, my bladder's normal. It's your nervous system that's amped up, just like it's my nervous system that's amped up, multiplied by a long-term muscle issue in my case. And so you've got to do everything you can to protect your nervous system here. You know, and that's not going to go away. You're blessed. You and I are blessed with that. Is we inherit that sensitive nervous system. And so soda, I have one soda every 4 to 5 years. And it's usually a diet. It's usually a 7-Up if I'm really nauseated. That's it. And I know that that's just too stimulating for me. And I think it's just way too stimulating for you. Okay. Yeah. And just remember the good side too. And that is, you and I, we're going to smell the fire first, and we're going to save lives because we are sensitive, but it's our job to protect our nervous system every single day. All righty.
Yeah. All right. Thank you.
Okay.
Thank you.
All right. Kayleen, I'm going to come back to you in a bit. Me. And you have to unmute yourself.
Unmute.
There you go.
Got it?
Can you hear me now? Yes.
Okay, wonderful. Thank you. You just popped up on my phone. I've never seen you before.
Oh, okay.
I thought, oh my God, I see. Yay! And then the question, so it was really wonderful. And you did answer a couple things. I wanted to clarify what I had was first rubs. First is like colic in a horse. It's where your intestine is extra long or diverticulized, whatever. Anyway, the large intestine was wrapped in on itself. So what it did was they don't have adults with this. So I went to a teaching hospital because they it was interesting. Okay. Anyway, took out the large intestine, took out the hysterectomy, whatever, gallbladder, all that stuff is gone. But the IC I was diagnosed with, and I've had it all my life. So I've had all these cystos and, the back in the years gone by where they were, the installations with Elmeron, and it was a lot. But after they took out the large intestine, great, it helped. But the IC, of course, was raging because you had to have a catheter for a month. It was a long time.
Oh yeah.
But that was a year ago now. So what I was left with, I had all the bladder attacks, and so the bladder doctor, wonderful woman, she she's done that hydro extension or whatever, those cystos. She's done that a few times.
Okay.
Um,
And what do they see when they look in your bladder?
she doesn't tell me, but she said it looks pretty good. That was her answer.
Well,
It's
but has she ever seen anything in your bladder? Has she ever seen irritation? Has she ever seen wounds or lesions?
no, I don't think so. Maybe before years ago, but this last time she did it, she said it looks good.
Okay.
So there was nothing to fix. So she, I have all the drugs, but I have the same thing you have with that drug, hydroxyzine.
Mhm.
I just didn't dare tell anybody because they're so quick to tell you you're crazy. So I was happy to hear you say, well, I wasn't happy that you had that, but I was happy to hear that because I had the similar dream.
Yeah.
And they were going, now the same thing happens with Amivic, same thing happens with I can't even smell or look at an antidepressant. So no drugs like that at all, cannot take it, oxycodone, none of the pain drugs, nothing. They all cause craziness. Anyway, but the Valium, she created a foam out of gabapentin.
Okay.
And that seems to help.
Okay.
And I take gabapentin.
Well,
So-
what are your bladder symptoms?
Well, if I get upset or say I eat the wrong thing, I will have I'll swell up. That's how I know. I
Okay.
start swelling up and
Okay.
getting very large. The bladder gets very big and it pain, burning, the whole, just like a urinary problem, but it's a bladder problem. And so I have a whole, counter full of natural things, bladder rest,
Okay,
all those
but
kind of.
wait, hold on. So hold on. Before we talk about treatments, we have to try to understand your anatomy here. So
Okay.
so you're an anatomical mystery to me right now. So let me repeat
to the Hirschsprung's people too. Yeah.
Right. So you have had many surgical interventions in your pelvic cavity. Do you have a stoma now, or are you?
No.
Okay.
Best doctor in the world. Oh my God. He actually created a area, it'd be like if outside, only inside. And he attached the small intestine to what was the rectum.
Okay.
So it all works.
Okay.
It's
okay.
great,
So,
but because of all those years of constipation, what happened was, because the basically the stool, part of it was on an angle, it's supposed to be on an angle, goes down.
Right.
Mine was 45 degrees and wrapped in on itself.
Oh God.
So they said how it ever got out. You eat and you're afraid to eat because it's not going to come out.
Right. Right.
But they told me I was crazy for years. They said, no, there's nothing wrong with you. You just live with it. You extra colon, blah, blah, blah.
Okay.
So anyway, they took that out. No big deal.
Okay. Wait. Okay. So we know you have a lot of scar tissue. We know you suffered because you've had surgeries.
But they did the hysterectomy, the complete hysterectomy when I was young. So all that's gone.
When did they do that? How old were you when they did that?
30, something like that.
Okay. But you've had bladder problems since you were a kid.
Yeah, I was born with this. This has always been like.
We're trying to define what this is, right?
I think it was the intestines being inflamed and 2 rectoceles.
Right. Well,
so
we know that the nerves of the bowel and the nerves of the bladder merge at the spinal cord at exactly the same place, so we get neurological crosstalk. We also have research that proves that when the bowel is irritated, the bladder can become irritated, et cetera, et cetera. So it really does sound like the bladder was a secondary victim of your long-term bowel issue. So the question now is, why are you still having bladder symptoms? Are your symptoms better now? Have your symptoms ever changed? Your bladder symptoms, are they better now, worse now? What's What's going on with you?
Well, because of the constipation's gone, I think they have improved. Now,
Okay.
would you say, what percentage would you say that is? You know, the bladder was just removed last year, and then the rectocele in August. Thinking recovery time. The bladder is kind of okay now. She did that cysto. So,
Okay. So
but on average, you know, I have flares. I read, I hear these poor young people with all this pain from IC.
So
that's constant.
Okay, so
mine is not constant.
Okay, but the other missing piece to this puzzle now is that you were put into menopause at a very young age because you had a total hysterectomy. And
But I didn't have hot flashes or any of that.
That's okay, but the bladder relies on estrogen to produce mucus. Your bladder is like your mouth. It is a hollow organ covered with a really thick coating of mucus. We call it the mighty mucus. The purpose of the mucus is to act as a barrier between whatever's in your urine and your bladder wall. And unfortunately, that mucus is estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus and you can get away with a lot of crap.
But I have those pellets, those hormone pellets,
Well,
the yam pellets, that gives you estrogen.
Not as much though. When you're older, you have much less estrogen, therefore much less mucus. Thus your bladder's ability to defend itself is now compromised. That's not a disease process. That is just aging. You know, that's what happens is the mighty mucus gets thinner and thinner and thinner and is not able to protect your bladder wall like it used to be able to protect your bladder wall. So there is no doubt that you have what we call the genitourinary syndrome of menopause. You have to have it at this point in time. And it's characterized by dryness, dry vulva, dry vagina, dry urethra, dry bladder. And that may be why your bladder is as sensitive as it is right now. So we also call this estrogen atrophy. And it has to be involved because it happens to every single woman. And for you, it started decades ago. And so, yes, you have pellets. Yes, you've got some source of estrogen in there, but where did they put the pellets? In your arm, in your thigh?
In your butt. They cut a hole and they stick the pellet in.
Okay.
And then it's painful. I was going to stop doing that, but now you're talking.
No.
Maybe you were here for a reason.
No. Topical estrogen in a cream form is preferred because more of it gets to the bladder.
Doesn't that cause cancer, breast cancer?
Oral estrogen is known for causing, well, any estrogen that gets through to the bloodstream and is distributed throughout the body is going to be a greater risk of cancer. And that would include the pellets because the pellets it's being absorbed systemically and being spread throughout your body systemically. Whereas topical estrogen and a lotion that's put right on your skin tends to stay in that location.
Where would you put that topical?
The vagina, the vulva, and the entrance to the urethra. So you have some work to do. You need to Google genitourinary syndrome of menopause. That has to be playing a role in some of your symptoms. I don't see how it can't be.
Say that again, genitourinary.
Here, let me type it in here.
Good.
Genito, urinary syndrome of menopause. So the next time you see your doctor, have her look at the quality and health of your skin. If the vulva is dry and the vagina is dry, so is your urethra and so is your bladder. And
I've always had dry skin. It's my own.
Okay, yeah. But there's a reason why. So this is where doing something that will give your bladder a little bit of an extra coating makes sense. Right. So that would have been the Elmeron would have been reasonable back then because Elmeron is a protective coating. But of course, we now know that Elmeron is linked to retinal disease and potentially blindness. And so what most patients do is a chondroitin-based supplement. Mary says, labia deep or shallow. You know, it just depends upon what your doctor do, Mary. I put mine on my labia because my inner labia is almost gone. It's just been reabsorbed into my body. So they told me to do that so I could try to maintain some structures down there.
So, I had a question. I asked you about this macroplasty, and I got your answer. So I'm not going to do that. But
well, no. You need to talk to your doctor about it. Hey,
well,
listen.
here's the question.
Yeah.
When I have the bladder attack, the vesicare, I have obviously the leakage more than normal.
Yeah.
So the vesicare actually helps that. Now that's a drug that I could actually take, but I don't like taking drugs regularly.
Right.
So is vesicare?
Well, it's not a treatment for IC, but if it's helping you, that's great. But we have to understand the anatomy to try to figure out why you're having attacks in the first place. And one of the reasons you're probably having attacks is because you are in extreme estrogen atrophy. Here, let me type this out for Facebook here.
I'm going to read up on it. I found the Hirschberger, so no one would believe me. So I can fix this too.
All right. So generally, in addition to using a topical estrogen product, we do well with something that will provide a coating effect, and that's going to be a supplement that contains chondroitin, and it's going to be either bladder builder,
okay,
or bladder rest. These are the top.
I take that.
Okay.
Bladder rest.
Or Cysto Renew.
I've taken that.
Or Cysto Protect.
Yeah, I've taken that. Oh, that causes that causes bad stuff. Okay. Cancer.
No, Cysto.
Yeah, they just proved that.
No. The problem with Cysto Protect is there is an ingredient in it in the capsule called titanium dioxide, which has been linked to lung cancer if you breathe it in, but it is FDA approved to eat as a food coloring. But what they did is they put a cancer warning on this, but they have now removed it. It's a different color, and so instead of it being a brown capsule, it's now a red capsule. So there's no cancer risk with Cysto Protect anymore, and there hasn't been for a year.
Oh, well, that's good. Does that actually help? Okay, so
and then the new one,
so I had been taking.
And the new one is Cysto Mend. And
never saw that.
So Cysto Mend is a match to Cysto Protect, but with the addition of pumpkin seed extract for an antioxidant effect. So, and it's also about $7 cheaper. So, but we have the Cysto Protect and we have the Cysto Mend in our store. So doing something with chondroitin will help that. But I think that missing piece of the puzzle might just be the topical estrogen. So have your doctor look at your skin and see if they agree. See if they agree that your skin is dry. Okay.
Wonderful.
I've got to go to Kayleen now, but I'd be happy to talk to you at some point in time. Okay.
Thank you. I didn't even know you sold things on your store. So maybe
we have a big store on our website. When I started this support group, I never meant to sell things, but I ran out of money. I did it all for free. And so for the first 5 years, I paid for everything. And it's just like, I can't pay for this anymore. And so we started selling books and chair cushions. And then we started selling supplements about 10 years ago for a very, very specific reason. This was when some doctors were telling patients the only treatment for IC was InterStim. And it pissed me off because InterStim has hurt a lot of people. Again, thousands of adverse events. And it just goes kind of like, Jill, people need a place to go where they can see the trusted supplements. And that's exactly why we decided to sell the supplements. So,
well, I want to thank you because even in just this short time of meeting you for the first time, you've helped me a lot. That's pretty amazing. Thank you.
Glad to help, hon. Glad to help. All right. Thank you so much. Kayleen, you've been very patient. Can you unmute yourself? Well, I'm going to try to unmute you. Okay, you're muted. Girl, how are you? How are you today?
Pretty good. Like it's just I'm so glad that I can, come back to you and say that I've been having bladder installations.
Okay.
He just my urologist, he finally just sat down with me and he's like, you know what, I can do this thing, but he's like, I'm not sure, if I can do it. And he was explaining to me, he's like, we'll have to open up the urethra, and I was like, and I'm like, sometimes it hurts, sometimes it doesn't because of the vulvodynia. And during the winter, my body likes to get bacterial vaginosis
Okay.
all the time. um, so I told him, I'm like, oh God, I don't know if I should do this. And he's like, I don't have to do it. And I'm like, no, I want to try.
Okay.
I'm like, maybe I can stop taking medications. And he's like, all right. So he signed me up for the first one. It went really good, even though like they had to tell me, they were like, Kayleen, breathe, Kayleen, breathe.
Uh-oh.
Because it's that kind of, I don't know if anyone else feels this, but it's that catheter feeling where if you breathe, if you move a millimeter, you're gonna feel it. I mean,
yeah.
it just like kind of punches you.
Yeah, the urethral pain is odd and unusual. I mean, you can just be walking around doing your thing, and all of a sudden you get this really sharp razor blade feeling like, whoa, what the hell was that? And then it goes away, but you're like, then when the urethra gets irritated, it really lets you know it's irritated.
Yes. And I have that poking feeling too that we still haven't figured out.
What kind of feeling?
It's like this poking feeling in my hood, like it's literally like there's a needle in my hood.
Okay.
And my OBGYN and my urogynecologist, OBGYN, is like, they're calling me crazy.
No,
So
and again, because if they can't figure it out, that doesn't mean it's not real. It just means they can't figure it out. So there would be two or three things that I would be considering with that. Number one, your pelvic floor. Number two, PGAD, meaning that your pelvic floor muscles are so tight, they're starting to hit that pudendal nerve, which is anytime you got pins and needles, anytime you have pins and needles, a nerve is involved.
yes.
Okay. So I had last year, or was it 2 years ago? No, it was 2 years ago. I started getting pins and needles. It started up front, right at the hairline, right at my pubic hairline. And just like little pokes, random poke. And then over a period of a couple of days, I started getting more pokes, more along the length of my vulva, until finally, not only was it the entire length, but it was in the meat, for lack of a better term. It was actually, I was feeling pokes on my labia everywhere. And it'd just be random. It's like poke on the left side, 5 minutes later, poke on the right side, 5 minutes later, little tiny poke, 5 minutes later, a weird poke down by my rectum.
Yeah.
And it felt like vulvodynia. And I went to the ER. I went to an emergency OBGYN, not the ER, but it was a same day urgent appointment. And he scraped me for yeast, put me on, he goes, I think it's yeast. And he put me on diflucan for 4 weeks. Didn't go away. Go back to a different OBGYN. She goes, I think it's eczema, because it was in the shape of a mini pad. She said she thought it was a reaction to a mini pad, skin reaction. Very common, apparently. Steroids didn't work. And I just was like, all right, I want to talk to the pelvic pain specialist. All she had to do was hear my symptoms. She goes, I know exactly what you've got. You've got a nerve entrapment. This is what happens when the nerve gets entrapped. It's the random pins and needles. And so what they did is they gave me compounded estrogen and lidocaine in a jelly form, like a Vaseline. And I use that topically to silence the nerves on the skin. But she also sent me right back to pelvic floor physical therapy, where yet again, my muscles were super tight. And yet again, I had to go back in and retrain those muscles and relax those muscles again. So I think you're dealing with something very similar to that.
Yeah, well, I've had it ever since I was, as long as I can remember, so maybe 2, 3 years old. I don't know if I had it as a baby, but yeah, so I've been kind of trying to tell that.
Okay, but
wait
a second. Wait a second. So you're saying you felt pins and needles down there from day one? From the time you could remember, you felt pins or needles?
Right.
Has it always been in the same location? By the hood, or is it by your rectum?
Oh yeah, it's by my hood, but it likes to skip.
Yeah.
Like it pokes, but you feel it down.
So it's referred. It causes referred pain.
I think
so. There is a birth defect with the pudendal nerve. So the pudendal nerve. Let me get my thing here. Uh-oh. Hold on, my bowel just fell off.
Oh.
All right. So. Right. Okay. So you're from the front end. And obviously we have our spinal cord and our last disc here. And then below that, we've got this triangular area, which is your sacrum, right?
Right.
And you see there's 8 holes in the sacrum. And those are where the nerves emerge from the spinal cord. Okay. So
they're pretty protected.
No, they're not pretty protected. I mean, the nerves come out of there, and then they pass through. So the pudendal nerve starts in 4 segments. As they come out, then it merges into 1 segment, and then it goes through something called the Alcock's canal. And then when it leaves the Alcock's canal, it splits into many segments, and it provides all the innervation for your crotch. So sometimes the nerve pathway is messed up, and it goes next to what is it? There's there's a hole that it goes through that sometimes it doesn't go through, it goes around. And that can be a source of a nerve compression too. So I think it would be real. I mean, has anybody? Okay. So I'm just I'm just thinking about this for a moment. So you've had a pelvic floor assessment, correct?
Yes, and I'm actually going back into pelvic floor physical therapy.
Okay. And when they checked your muscles, what was going on with your muscles?
Well, urologist, he found just my bladder spasms very easily, and then
but what was going on with your muscles?
I think everything else, it just, when I'm, when there's something going on, I'll everything just spasms, and I can't stop it. It's like just trying to catch your breath. And I can't do it.
Okay. So have you had pelvic floor physical therapy yet, or is this your first time?
No, this will be my second time, and with the same therapist. So that's nice.
Okay. So when you go at your first appointment, her job is to evaluate your muscles. We want to try to understand what the hell's going on with your muscles. So you've already had that done. It's a very slow process. They look at your legs, they look at your core, they look at your butt, they look at your back. Externally, they look at how you're walking. Are you walking normally? We want to look for any unusual tension patterns. And then she will do an internal assessment to try to touch muscles, right? And the only way to do this is with a finger. And so we're going to have a finger through your vagina, and she's just going to touch muscle groups on both sides. And it's going to be really interesting to see what she finds there, because if your piriformis muscle is tight, that could squeeze the nerve and cause an issue. You ever have pain shooting down your leg? You ever have sciatica?
Oh yeah, I got this is my my MRI. You could see, I mean, there's nothing left here and here.
Wow.
So I'm getting both of these treated.
So you're kind of bone on bone, right?
Yeah, it's, I mean, all my lady junk is, you know, in here.
Okay.
So yeah, it's really bad. I'm having surgery in April. They're gonna do the I can't say it because of my braces.
That's okay. That's okay.
Discectomy. I
Right.
think that's how you say it.
Right. Okay.
So yeah, they shave the bone so that the nerve that is affected can, you know, have more room. So I'm not in pain all the time, because there's nothing wrong with me. It's just that everything is pinched, and
right.
you know,
And that's what you're describing. But that's what you're describing. The pins and needles in the hood, that's pinching. That's nerve pinching.
right.
And so the question is, but the question is, where is the nerve being pinched? It can be pinched at the spinal cord, or it can be pinched lower down in your pelvis by tight muscles, or it can be pinched, it can be pushed up against something like a bone.
My good days, so these are like the days where my back is left alone. Like my back doesn't hurt.
Yeah.
It is pubic pain.
Yeah.
Pubic, and it goes down my left leg.
Okay.
So
I just compressed two nerves in my back. I ruptured 2 discs a month ago. And my right knee, I still have to use both hands to get up off of a toilet right now. It's ridiculous. Because I'm numb by my right knee, although it's getting better. But it's amazing how an issue at the spinal cord can change a leg. Right?
Right.
So the good news here is you've had a proper evaluation. The good news here is you got through an MRI. Holy hell, those are not fun. You know, and the good news here is that you're scheduled for therapy, and we know where a nerve dysfunction is happening. And it's going to be fascinating to see how your other symptoms change when you get this fixed. I'm very happy for you. I think this is very promising.
And for my back and stuff, like I'm really happy. I want to get back to life.
Yeah.
But one thing I do have a question about.
Yes.
I don't want to take up all your time.
That's okay.
Is when I do get the bladder installations, I will be walking or I'll scream. I have 2 cats here.
Oh.
I'll be screaming at the cats, or I'll have to, you know, maybe like shout across the house or something, you know. And what happens is like, it's like this quivering, and it will not stop. And I'm like, oh my God, stop. And that's when it turns into a bladder spasm. And I'm like, all right, I can't stop this. And I kind of panic. I do panic more when I don't have any protection, but when I do have a pad, it's okay if I do leak a little bit.
Does the quivering hurt? Is the quivering?
Yes, because I'm trying to stop it and hold it back.
Okay, so while I'm sitting here, I'm having a quivering by my left sit bone, but it never hurts. It's just we call it a fasciculation. It's like an eye twitch, only it's a muscle twitch, probably from a muscle that's a bit on the weak side.
Well, no, this is my bladder, and it's strong.
So concept number 1 is is there something that's triggering a nerve that's irritating your bladder and causing your bladder just, because I look at that as kind of like the bladder screaming. It's like the bladder screaming for your attention. It's saying, ow, 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 something serious is going on. And so concept number one is being able to link that to drinking soda or coffee or anything irritating or a multivitamin.
I don't do anything. I quit the multivitamins because of my braces. Can't
Okay.
do gummies.
Okay.
And then no caffeine, no pop, nothing sparkly because of
Good.
my heartburn.
Good.
Yeah,
Okay.
nothing.
Good job.
I do juice.
What you do what?
I do juice. I do mango juice and apple juice and a lot of water.
So
I got a lot of water.
So dilute it 2-to-1 with water. Don't drink straight pure juice. Dilute it massively with water. And you got to be careful and make sure there's no citric acid in the juice. You got to get the right kind of juice. So mango would normally be fine as long as there's not a lot of citric acid in it.
There probably is a lot, and
I never, ever, ever drink straight fruit juice. I'm always going to dilute it. I'm going to put, in a glass like this, it's going to be this much juice and that much water. Always. Okay. So try diluting the juice a bit more. Okay. But look at the apple juice. And it should be organic. Whatever juice you're doing, make sure it's organic.
Okay.
Okay.
Yeah, I have to do it because of my IBS. I mean, that's like my probiotic. It keeps me clean. Yeah, cleaned out, and
okay.
I'm not constipated and stuff like that. So
okay.
But I feel like the quivering and the spasm, it does come from me yelling, and like I said, it's only after I get the bladder installation. So it just feels like my urethra is weak and bladder is weak.
Or it goes away. I mean, so you're vulnerable to the quivering for the first 24 hours, and then after that, do you not have a problem with that anymore?
No, it lasts about like 5 or 6 days.
And will the quivering last for 5 to 6 days, or are you vulnerable for 5 or 6 days?
The quivering will last for 5 to 6 days. It's not all the time, but it does.
Okay. And so have you ever tried an antispasmodic like Ditrapent? Does that turn it off?
Oh, I was doing something. I'm taking Bentyl right now for bowel, which I guess it can also help pelvic spasms, but I was
talk to your doctor about
that. I was taking oxybutynin,
Yeah.
oxybutynin, and the dry mouth, I couldn't do it. So.
Okay, but maybe not doing oxybutynin every day, but maybe doing oxybutynin for a couple of days after would be a perfect solution for you.
Yeah, since now I'm going to be quitting the hydroxyzine because I went to my primary doctor, and right now she's on maternity leave. So her nurse practitioner saw me.
Okay.
And she's like, I'm going to send you to a dermatologist. But I went to her and I'm like, why? Like, why am I losing my hair? And it's not that I'm losing my hair, we found out. It's that it's breaking as it goes down. And I'm like, I'm 26 years old. Like, all of my family has thick hair. Like, my grandpa died, which today is his 3rd anniversary. I'm like, my grandpa died with thick hair. Like,
did you take Elmeron? Did you take Elmeron?
No, shockingly, but something told me, I'm like, it's either hormones or it's medication I'm taking. And my family started noticing it a lot more. And I'm like, all right, I cannot do this anymore. But I went to her and she did research while I was there. She's like, okay, Depakote is one which I take for mood stabilization. And then Vistaril, she said, is another one.
Okay.
So just called my urologist this week or this past week, and pill a day, but now I'm thinking maybe I don't need it at all.
Well, talk to your, I mean, with every medication, there are pros and cons, risks versus benefits. And when a medication starts interfering with your quality of life, that's when you have a discussion with your doctor about what your options are.
Right.
And so Elmeron is strongly associated with hair loss, but other medications have been associated with hair loss as well as thyroid changes. I always know my thyroid is all whacked up when I start losing hair. And I have a lot of hair to lose. And when it starts falling out, it's ridiculous. And so whenever I go through periods where I'm seeing a lot of hair falling in the shower, collecting at the base of the shower when I wash my hair, I always know my thyroid level is off. And we go and have a thyroid test, and it's always a little bit up, a little bit down, a little bit up, a little bit down, trying to tweak that. So that would be something worth looking at too, hun.
I actually, if you could see it, I just got checked. So I'm waiting for the results, but I'm always sitting on the low side of normal.
Yeah.
So they can't legally give me anything. That's what sucks.
Yeah. Well, the one thing you can take confidence of in the human body is it's designed for healing. Healing never turns off. It's always happening. Our challenge is, especially in 2020 with the foods and the chemicals in our daily lives, and as well as a tremendous amount of stress that we're under, especially in the last year, that interferes with healing. We are all in a challenging environment right now, physically, mentally, and emotionally. What I want you to remember from this is that none of this is your fault. You have done absolutely nothing wrong. And to Eric, if you're still listening, you have done nothing wrong. No shame, no blame in all of this. You are an anatomical mystery to be solved. And you especially are. But the good news is we now have big giant clues for you. Big giant clue number one is that you've got nerve compression at your spinal cord. And by resolving that, it's going to be fascinating to see how you do. And I bet you're going to be doing a lot better. I do want to just say, I want to end this with one thing though, because I don't want you to be, you can talk to the anesthesiologist about this, or talk to your doctor about this. Sometimes after you have surgery, you have a little bit of hair loss about 6 weeks later.
Yeah, I know about that.
Okay. So don't freak out about that. It's going to be fine. I always, whenever I see myself losing hair, it's like, oh my God. But then it's like, Jill, you have so much freaking hair. It's okay. You can lose some. I totally get how you're feeling there. So listen, hon, I want you to keep me posted, and I would love to talk to you more, but time is going, and I've got to talk to Raylene next. Okay.
Yes. Yeah, I got a colposcopy coming up, so I'm gonna go ahead and go under for that.
Ooh.
Okay. And then this week I do have coming up the epidural injection for my back.
Okay.
Because they're being nice. My pain management doctor, he's being nice, and he's like, I'll do the epidural up until you have the surgery, because I'm like, I can't do this. Like, I need the epidural.
Yeah, something, anything, please.
So yeah, he's doing that, and then surgery is in April. So
all right.
I'm anesthesia is my best friend. So
oh, hey man, I'm a huge fan of propofol. I always tell everybody, even with dental work, listen, if I have no memory of what you're doing, that is a victory. I don't care what you do. I just don't want to know what you're doing while you're doing it. So anyway, all right, hon, listen, nice talking with you. I wish you well, and please stay in touch, okay?
All right, thank you so much.
You're very, very welcome. Okay, Raylene, thank you so much for being patient. You're a sweetie. How are you doing today?
I'm okay. I'm new to all this. So
Okay.
I've been dealing with UTIs, I guess, discomfort and stuff for about 2.5 years.
Okay.
And kind of ebbs and flows and so forth with different things and a lot of other discomfort and stuff. And then finally had another UTI beginning of November, and then beginning of January thought I had one again. And long story short, finally last week, I'm like, okay, enough. Like I need to kind of be my own advocate and get to the bottom of this a little bit more. I do live in Canada, so
Okay.
that's the difference there. So I reached out to my family doctor again. Again, I was more focused on the UTIs. I had never even heard of IC at all till
Okay.
Friday. So this is very new. So reached out to my family doctor, and she was basically, unless you're getting UTIs every month, we won't do any further tests with you. So then I reached out to a gynecologist, met with someone new over the phone. Here, they're trying to do as much over the phone.
Yeah.
And I had done some little bit of research and stuff, again, more focusing on, I am perimenopause, I would say.
Okay.
And so I've seen an increase in the discomfort and the UTIs
Okay.
about the same, like it's not coincidental with those timelines.
Okay.
So he did give the option at the time for me to think about doing like a low estrogen cream.
Okay.
And possibly, again, when we were focusing on the UTIs more at that time, thought maybe doing like a low dose antibiotic. But I get a lot of, I have to go very healthy. That's why I worked over the last few years because of infections. So I have to be very cautious with my sugars, with my antibiotics. All those things are factors that it's a last resort for me if possible.
Okay.
Um,
Okay. So let
when did-
me ask you a couple questions here, just to help me try
Please.
to understand. Because again, I always try to understand the anatomy before we talk about stuff. So number one, how old are you?
I will be 46 this summer.
You do not look 46. Are you
Thank
kidding
you.
me? You look
No?
beautiful. Well, hey,
Oh, thank
listen,
you.
I'm 60, and as far listen, 46 is the new 26, 60 is the new 40. I'm just going to embrace it all. There it is. Okay.
I just want to feel good. I don't
Yeah,
care what
I
age I
know.
am. I just want to feel good.
So when did the yeast infection start? How old were you?
I have struggled with yeast since 15
Okay.
and really focused on working kind of naturally for the
Okay.
last maybe 15 years. So, but right around 30. And that's why I started with naturopaths and stuff. And
Okay.
yeah, but it's,
what yeast did they identify?
they never said a specific yeast.
Okay. Okay.
They've never said a specific yeast.
Okay.
It
Okay.
did seem to be worse with my cycle. Like it would be before my periods and stuff would definitely ramp up. Again, if there was any antibiotics, any sugar, anything like that. I have a very I've learned so much just listening today, but I have a sensitive constitution. So I react to things very much. And it's gotten almost worse as I've gotten older. I've become more sensitive, like makeup, with foods, with, yeah. So I do try to be fairly healthy, but yeah.
Okay, guy, for everybody watching, we've talked about this before. IC subtype 5 central sensitization. Okay, so, and I know you don't have the context for that, but we're gonna run back to this. So, number one, do you have super sensitive skin?
Yes.
Are you drug sensitive? Can you take normal medicines, or do you have to reduce the dose by half or a quarter to take medicine?
Most of them I can tolerate. I do have I do react to sulfa. I've had a reaction with that, but most things I'm okay. But I do, yeah, I am sensitive with stuff. So we try usually doing the least invasive and work up always. Yeah.
Okay. Do you have a wicked sense of smell? Can you smell things that other people can't smell, and do smells actually kind of hurt you sometimes?
I do have a strong smell. I don't know if it'd be wicked smell, but definitely strong. Yeah.
Okay. So like with my last boyfriend, I used to freak him out because I could kiss him and tell him what he'd just eaten. Do you have
Oh yeah, I like that with my husband. Yeah. Okay. Yeah.
Okay. Okay. So
I can tell if he's had like onions at lunchtime when we're
Yes.
together in the evening. Sometimes, yeah.
Exactly. Okay. And sometimes there can be visual sensitivity, where if there's a funky carpet and a wallpaper or
I'm
drapes,
sensitive to light, like, but I had laser eye surgery done 20 years ago, so I never know. But I am like with fluorescence, with whatever. I always wear, if I'm out, I wear sunglasses.
Okay.
Yeah.
Okay. So and like you have this beautiful thing on the wall behind you. So and for me, I love the fact that your colors are very muted. I need, like, I could, you know how right now the fad is to do kind of spam whites. I can't do that. Makes my eyes crazy.
Yeah, I'm very much. I'm the lights are. Yeah, I like lights are important to me. Yeah.
Exactly. Exactly.
Yeah.
Okay, so let's talk about central sensitization for a moment. Central sensitization means that your central nervous system, and my central nervous system, is easier to turn on. And it's genetically hardwired that way for some of us. What we find is that people of a Northern European descent, that this is more common. Hello, redhead.
I'm a Scottish descent.
Oh,
Yeah.
same thing.
Yeah.
Same thing. You know, Eric the Red went between Norway and Scotland, and there you go. So what does that mean? So evolutionary adaptation is important, because what that means is that species adapt over time to their environment. The fastest cheetahs survived because they could catch food. The fastest gazelles that could outrun the cheetahs survived because they could, because they could outrun their predator. Life in Northern Europe, well, and we know too that an evolutionary adaptation takes a minimum of 5,000 years to happen. So it's a very slow process as animals and species and our bodies adapt to new things. So let's go back to 5,000 years ago in Scotland, just like it was 5,000 years ago in Norway. What were they eating? Literally the world's blandest diet. They were eating fish, they were eating deer. For the few deer that were there, they were catching whales and seals. They were eating fruit once a year, berries, when it was ripe. The only time they were exposed to sugar was that one time a year when their berries were ripe. I don't know if they had apples. Do apples grow in Scotland? Probably. But what they didn't have...
Sugar and me do not agree. And that's why I've been very low sugar, but I haven't paid attention to the acid part. I just sort of downloaded that app, and I drink a lot of lemon water, trying to be healthy, because I don't drink whatever. I'm like, oh, that's probably really bad.
Okay, but let's hold back then. Think about this for a moment. Where did citrus come from? Citrus comes from the equator. There was no citrus in Scotland 5,000 years ago. They certainly did not have daily acid exposure. And so if we consider the concept of evolutionary adaptation, what we can say is that your body and my body is adapted for life in a very simple environment. The one thing that kills me is chocolate. It started in my 20s. I could eat chocolate as a kid. And then all of a sudden I had bowel spasms from chocolate. My body interprets chocolate like poison. Chocolate comes from Africa. So my body does not know how to process chocolate well. It literally interprets it like poison, just like it interprets oatmeal like poison. I also don't eat oatmeal. I have terrible bowel spasms with oatmeal. So this is not part of the central sensitization, is not a disease. It's nothing that we did wrong. It's just how we're born. Every tribe needed somebody who could smell good food versus bad food. You and I are in that tribe. We are in that tribe. And so the hard reality is that we're born with a more sensitive nervous system. And that's not just manifested with our senses, it's manifested with our skin. Now, I had vulvodynia from the ages of 18 to 24 or 25. And it was yeast infection. They kept saying yeast, it's yeast, it's yeast, it's yeast, it's yeast. They never once identified candida in me. And half of the time they look at me and they go, you look fine. You look normal. There's nothing wrong here. And I'm like screaming, going, I can't even wear underwear right now. My skin is so raw. So if I were to guess, again, you are my sister in sensitivity, you probably never had a legitimate candida infection. You probably had the nerves in your vulva had become extremely sensitive for one reason or another, usually because of some sort of trauma, like falling on your tailbone, something like that, where the nerves in the area.
I've had a few, like I was listening to your stuff, like I've had 2 rollover car accidents, and then I've had 3 rear-ending accidents in the last few years. Like the car accidents was when I was like 16 and when I was in my early 20s. But then the rear end, I had 3 in the last few years, which I don't know if
Okay.
it's coincidental or not with the timing of this, but probably didn't help.
And let me ask you this: when you were you ever able to do caffeine, or does caffeine keep you up for a couple of days?
I don't do a lot of caffeine. I just, again, try not to. If I were to have some, it's not like I never do. It wouldn't be to that extent, but like I definitely wouldn't have something before bed and then it would affect me for
Right.
sure.
Okay.
Yeah.
Okay. The other time central sensitization happens is after trauma, after a car accident or a fall. And so sometimes it's not inherited. Sometimes it's just the result of some sort of trauma.
I think I've had before, I think it's ramped up with maybe with that, with a lot of, I have a new job the last few years and it's been extremely stressful, which has,
Right.
it seems like on the weekends and stuff, I do better. And then during the work week, I have a lot of pressure with my job.
Sure.
And so I find that it ramps up and yeah,
So, what would tell us once and for all if this is an issue, because frankly, you and I have kept the yeast company's business, they've made a lot of money off of women. And if I had stock in the company that made a lot of the yeast products, I think I'd probably be doing pretty well right now. Now we have a next generation DNA test that will tell us once and for all if you have a fungal infection. And you can have a fungal infection, obviously, from your reproductive tract, but you can also have a fungal infection in your urinary tract. And we had research from the National Institutes of Health that proved that this was about 5 years ago, that many women who were flaring because they had an overgrowth of candida in their urine. And they've continued to expand that research, and they've now identified 13 different species of fungus in the urine of some IC patients who were flaring. And what they found is the more species they had, the worse the pain.
Because it was interesting. I went on Thursday. Again, I was focusing, like, got to figure this out. Had a urine test at the lab, whatever. And so it came back that I had, I'm not saying it right, but leukocytes or whatever present. Did the culture. So I thought, okay, yeah, it's a UTI within the culture. No, it's definitely not a UTI. But how come I have some of that present, that my body's fighting off an infection of sorts?
Well, but see, leukocytes will be in your urine after injury too. Because of estrogen atrophy, your bladder lining is getting thinner. So urine is able to penetrate into the urothelial cells. Those cells down there communicate to your immune system that something's here attacking them. So your immune system immediately sends leukocytes to the area to fight whatever the invader is. But the real interesting question here is, how did the leukocyte get out of the capillary and into the tissue itself? And the answer is your capillary is open and they release them. And that's why we have leukocytes in our urine, even during flares. Okay. And so if you're having a bladder wall flare, leukocytes would make total sense. But that still isn't dealing with the problem with the urine culture is that it's done on a growth medium, and whatever will grow on it is limited to what's in that growth medium. So urine cultures will miss, I think the last figure was 95% of the potential things in your urine. And so the future is, in fact, next generation DNA testing. And in fact,
so how do you do this testing? Like, is that something I don't know.
It's just a urine sample.
Where you get access.
And I just want to say that the top IC researcher, Curtis Nickel, who's in Kingston, Ontario at Queen's University, did a keynote speech at the American Urology Association meeting last spring, in which he said next generation DNA urine testing is the future of urine testing, because it will tell us if you have good bacteria, bad bacteria, and fungus. And the fact that you flare when you do sugar suggests you probably have a fungal infection, because candida need sugar to grow. So when you give it sugar and you flare because you have an overgrowth of candida. So having a next generation DNA urine test would be fascinating for you, in my opinion.
And where is there information on that I would?
Bladderhealth.org. Bladderhealth.org is a website that I built a couple of years ago. that talks about it. And that
Okay.
company works with patients in Canada.
Okay.
You do have to have a doctor sign the lab slip. You order the test, they ship it to you. In there is a information sheet where you put all your info, and you get a doctor's signature from that, and you send it back, and they'll be able to tell you within. You get your PCR results in 2 to 3 days, and you get the rest of it in 4 to 5 days. That'll tell us once and for all if you have fungus. And if you do, like I was working with somebody last week, 100% fungus. And it was so important because all the antibiotics were not killing the infection because it wasn't a bacterial infection. It was a fungal infection.
Just whether I can get my doctor on board. And she doesn't seem as concerned, you know, like she was just sort of like, well, what's this one? Like, it wasn't her that mentioned this IC. It was my naturopath that finally, this is the first person that's even said it to me, was my naturopath.
Well, is your naturopath a doctor?
Well, yeah, his Dr. Craig. Yeah, but he's
so
a naturopath.
That's okay. You should be able to sign
Okay.
it.
Okay. Because it wasn't my family doctor and it wasn't the gynecologist. It was the naturopath. And again, it was just on Friday. And that was the first I've even heard of this. And I Googled it and I'm like, oh my gosh, this is the closest to what I've heard of something that sounds like what I've been feeling.
Well, and so again, we've got a bunch of things we've got to rule out. Number one, you're sensitive. It is what it is.
Yeah.
We all grew up that way. The vulvodynia can be a sign of sensitivity, but the vulvodynia can also be a sign of fungal infection, and this will help us rule that in or out. You can do a urine fungal infection, and you can do a vaginal swab. I mean, you can do a urine next-gen test or a vaginal swab next-gen test. And at this point in time, that would be a very interesting piece of information for you. It'd be fascinating.
100%.
Yeah,
And
fascinating
it helped
to
with
see
my
what's there.
naturopath too, to get that more information to see what we're dealing with. Yeah.
It would be very, very curious. So now we've got the other issue that we've got going on is you've got physical trauma. You've been in 5 car accidents. And so the next thing we absolutely have to look at is your pelvic floor. Are your pelvic floor muscles
I actually booked for the first time again when I was doing all this checking, whenever I have an appointment in 2 weeks.
Good.
With like for a pelvic physio assessment,
Good.
whatever, to kind of just see. And again, that was the naturopath kind of recommendation, just to see what we're dealing with, because I've had such hip pain. I've got, when I think of my discomfort a lot of time, it's right at the, like if you think of your pubic, whatever, right to where that would, like where you, just right where you had your, I had a C-section with my son who's 17 and a half, and it's right, almost right where that incision would be. That's where, when you talk about being very tight and stuff like that,
Okay, so
that would describe it.
is it in a line going straight down?
No,
Is
no,
to the left
the
or
other
right?
way. Yeah,
Okay, so
100%.
so that's muscle. That's not
Yeah.
your bladder, that's muscle. And is your C-section scar sensitive when you touch it?
No.
Okay,
I wouldn't say
if you roll it between your fingertips, is it sensitive?
I don't know. I have had massage done. What do you call that? Visceral massage, whatever. And when he's worked on there, he's worked. There's been a lot of issues, a lot of tightness, whatever. So there's definitely some, yeah.
Okay. So that again points us to muscles, and so make sure you tell the physical therapist. The physical therapy appointment. Your job is to get her to study your body. And I always say that I want you to walk in and be able to describe your symptoms really well. But not just the big symptoms, the little symptoms, the little pain you get by your left hip bone, the little twinge you get every now and then by your rectum, wherever. The devil is in the details here. And so
Can you help me understand one thing? This is one thing that I like, it's kind of strange to describe, but I feel like to you I can describe. When I start getting, I guess you call it a flare up or reacting or some pain, whatever, a common day would look like, it would start with just a little aching, whatever. It would get worse. And then what would happen is I would start to bloat.
Okay.
And by the evening, when I finally relax, I guess, the workday's done, I'm relaxed, whatever, what would happen is the pain would leave from that kind of lower pubic bone, and I would blow up like I look like 6 months pregnant.
Mm-hmm.
And it would kind of follow that same cycle. And then my system would calm down. By morning, I would be almost back to normal, if you will. Is that
that's common? That's very, very common. We call that the icy belly, and it's basically just kind of an inflammatory reaction.
Okay.
So, I mean, that's something that we see, but that brings up the third point then, and that is, suspect number 1 is sensitivity. Suspect number 2 is fungal infection. Suspect number 3 is pelvic floor injury or trauma. Suspect number 4 is going to be the quality and health of your skin, estrogen atrophy. And you are at that age. Are you still having your period?
Yeah, like quite regular. I do have spotting and stuff, so that was what I was dealing with before. But no, like it's like clockwork.
Okay.
But I definitely have perimenopause. Like I am not having hot flashes, but I'm hotter. I'm like, things are changing, right? My sleep is changing. Things are changing sure.
Have you had the rages yet? Where it's just like, you're 1 minute you're fine, the next minute you're so angry, man, you want to hit something.
No, I wouldn't say that. I do get fresh or whatever, and I do have like, it would be more sad, if anything, I would say. I don't get the rage, not the rages yet, but we'll see how it happens. But definitely things are changing for sure. For sure.
So that's the other thing we want to know is have the doctor look at the quality and health of your skin down there. And if you're showing signs of dryness and estrogen atrophy in your vagina, and it's very easy for them to see because your skin develops these funky lines or something. You can assume that if you've got dryness in your vagina and on your vulva, then you also have dryness on your urethra and your bladder. And so this might be if it's visible and they can really see it, then using a topical estrogen cream would give that skin exactly what it needs.
Started on Friday. I just started a cream on Friday. So I'm supposed to do it every day for 2 weeks and then twice a week or whatever.
Okay, so when you put it on, was it hot?
Did it feel hot? I have it like an injectable tube that goes up. There was no discomfort.
Okay, good.
And I'm very sensitive, so I'm like, oh, I wonder how I'm gonna feel, but no, I was fine.
So the good news is that your skin is not in bad shape, because the drier you are, the more hot the estrogen gets at first.
Oh, okay. No,
so the fact that you didn't react to that, that's great. So you might be catching this at exactly the right time. So, you are a classic icier, but we do subtyping now. We have to try to understand the other things that will absolutely influence the health of the bladder and trigger these pains. And so you've got, several really clear things that you just need to rule in and out. But there's nothing here that's scary.
No. And I'm glad to, again, this whole food thing, that's a new thing for me to be aware of.
Yeah.
And I do think stress, I know for me, stress definitely affects it. Is there I've never, again, this is all new, so I've never taken anything to relax a flare. And that's what it feels like. It feels like when it almost feels like it's spasming or whatever. What can you recommend as a starting point for some? I've taken nothing for that.
It depends on the type of flare you're having. If you're having a bladder wall flare, say you had spaghetti with a lot of tomato sauce and you notice that now you're not sleeping well, that's probably going to be a bladder wall flare. We have an hour by hour rescue plan in our flare management guide. And basically the first thing you do is you try to flush out what's irritating your bladder. So we need you to drink a bit of water, not a massive amount, just a glass or two, just to try to get things moving. The second thing we want to do is alkalinize your urine to try to counteract the acid. And so doing some pre-leaf, if you haven't seen pre-leaf.
It was the first, and is that something in Canada that we as well?
You might. We can send it to Canada. We ship to Canada in our store. Something that will alkalinize your urine.
Something good to have on hand, but not take all the time. But if something is bad, that's a good.
Or even dissolving a quarter teaspoon of baking soda in a big glass of water, that will do the same thing. Or just taking Tums, something with calcium carbonate, so it will work. That will also help alkalinize that urine. And usually from that point, we're then going to be looking at medication, but that's hopefully a couple of hours later. If your bladder starts spasming, using an antispasmodic like Ditrapent. A bladder spasm generally starts as the last couple of drops are coming out of your urethra, and then your bladder walls, your bladder is now contracted, and when the bladder walls touch, it kind of triggers this like a shaky, icky feeling, especially if the bladder wall is not healthy, it compromised more. And so using an antispasmodic just as needed would help with that. But that all come with the risk of side effect. You know, some of these medications are anticholinergic medications. Anticholinergic medications taken on a daily basis have been linked to cognitive decline and dementia. So we really don't want to be doing those daily. We just want to be doing those as needed. From a daily standpoint, you would want to be doing potentially something that would protect your bladder a little bit more. So something with chondroitin. Now up in Canada, you should be able to get something called Ialuril. Ialuril. Ialuril.
Okay.
And
what is that?
That's a bladder installation that combines chondroitin and hyaluronate. And it is the most effective bladder installation used in Europe and Canada. That would kind of be an interesting experiment, because if putting a coating in your bladder makes you feel better, then that tells us that your bladder wall is the issue. So that's something that you have that we don't have down here is Ialuril. Or they can do a rescue installation. A rescue installation is heparin, lidocaine, a little bit of triamcinolone or sodium, some sort of cortisone, some sort of antibacterial. It's called a rescue for a reason, because it will rescue you out of a flare. So if, again, you've irritated your bladder consistently, or you're one of those people drinking coffee or soda every day, we want to try to calm those nerves down.
I do have decaf. So no decaf, right? Because I have like decaf iced lattes that I make healthy versions to try and whatever. But now I'm listening and I'm like, because that affects the pH. Is that why you don't like that's?
Well, there's still caffeine in decaf. Okay. Not as much, but there's always still a little bit of caffeine. But it's also acidic and irritating potentially. We have super low acid coffee beans. The best company that makes that is Bella Rosa coffee.
I feel like I could give that up, but I'm just wondering if there's options for like, again, so I'm not having, I used to just make my own lemon water and drink.
You shouldn't be doing that either.
No, I'm not. So I went off of that now.
Yeah.
Anything, because any artificial sweeteners, all that bugged me. So I can't have artificial sweeteners of any sort. And I can do peppermint tea and I can, whatever, plain water. Is there anything that you can put in your water? To flavor it, that would be, or it's all going to be irritating?
If you go over to icdietproject.com, that's our diet website, and there's a whole bunch of recipes there for bladder friendly drinks. I mean, you could do add cucumber and peppermint or berries or stuff like that to give it a little bit of natural flavoring like that. But there's no powder mix that you can put in. But let me get something I want to show you. Hold on a sec.
Okay, and I'm just going to get my charger. Give me 1 second.
Okay. So one of our members, like 2 years ago, said that she had found this new herbal coffee that she absolutely loved, and it's called Dandy Blend.
Oh.
And it's a roasted chicory. It's extracts of roasted barley, rye, chicory root, dandelion root, and sugar beet. So let me hold this up again. Dandy Blend. And it is so good. My dad is 98 years old, and he's got, if he drinks coffee, man, he's got to pee all night too. A 98-year-old bladder is just not fun. So it comes in these little sticks, and you just pour it in. This smells exactly like coffee. And half of the joy of drinking coffee is just the smell, just holding it and smelling it. And I just have to say that this is what I'm doing now. I'm going to make all my ice drinks with this also. I went back to coffee last year, And I lasted about 9 months before my entire central nervous system turned on. And I feel it in my heart. My heart just gets very arrhythmic and I start throwing PVCs. So this is the new gold right here, Dandy Blend. You should be able to get this from Amazon. Just try it.
I'll try. Yeah.
Just try it. It's so good. You do also have there is a low acid coffee company in Canada that we used to sell all the time, but we just had problems with importing it. Euromild. EUROMILD. So you could potentially try them too, but I think it's important to take at least a couple months off and just give all those nerves an opportunity to calm down.
Well, yeah, and it's just been a big learning curve. I learned about this on Friday, and I'm trying to do research and make some appointments and figure some things out. And sort of, but at least I have some hope again, because I'm I feel like I'm going crazy because it's not something that I know anybody else that's had something like this, and I just
I think for me, because for me, everything hit in my 20s. So I had frequency urgency in 7th grade. I had yeast infections in high school and college. And the doctor kept saying, you have the most sensitive skin I've ever seen in my life. But it was always yeast medication. Then I threw ovarian cysts, polycystic ovarian syndrome.
They just kind of outruled that this past year. So for 20 years, I thought I had PCOS.
Right.
Yeah.
And then it was the IBS hit when I was 22, 23. Then migraines hit for about 6 months. They went away. And then the bladder pain started in when I was 33. Now, we understand why that happens now. And I just, in our magazine, we just did a huge story on it. Now we know why people get what we call chronic overlapping pain conditions. So I think I had the bladder stuff first, then I had the vulvodynia, then I had the IBS, then I had, and throw TMJ in there, that's in there too.
I had TMJ too.
Okay.
Just a big flare up, yeah.
Oh, yeah. For me, my left side clicks at night. No matter how I sleep, I end up clicking on my left side.
Yeah.
So chronic overlapping pain conditions is, in fact, a central nervous system disorder. And it's like central sensitization. Generally, what they find is that it is a nervous system that has become maladaptive. So what does that mean? So it's not a mental illness. Nobody's saying anything about mental illness here. We're saying it's a nervous system that is stuck in fight or flight, that this patient is living with a lot of anxiety. And it happened because they started doing a lot of brain scans on patients with chronic overlapping pain conditions. And then about 7 years ago, they started doing brain scans of IC patients. And what they saw exactly the same thing in both groups, not for every IC patient, but for the patient with the overlapping pain conditions. And this has a happy ending, so don't freak out. Okay, so what they found was a brain functioning like you're fighting for your life. And typically somebody with chronic overlapping pain conditions, we have a lot of anxiety. And I had massive anxiety disorder from 15 through 35. A lot of catastrophizing, the world is ending. It's going to happen. Why should I try? You know what I mean? Okay. So both the chronic overlapping pain research and the IC research consistently find an activation of the sympathetic nervous system. Now, the purpose of the sympathetic nervous system is to save our life. It is not normally on every day. It is on when you open your door and you see a saber-tooth tiger. You get startled, and immediately your sympathetic nervous system turns on, your amygdala in your brain turns on, and it triggers adrenaline, and it increases your heart rate, it increases your blood pressure, it increases muscle tension, it changes sugar levels, because your body is preparing to fight or flight. But normally, after the threat has passed, the parasympathetic nervous system takes over, and the parasympathetic nervous system's job is to calm everything down. It slows your heart rate. It reduces your blood pressure. It relaxes your muscles. So normally we should be functioning parasympathetically, not sympathetically. But for you and I, we got stuck in fight or flight. So the class I took at the International Pelvic Pain Conference this September, the best class was the pediatric risk factors. Why does this happen to some people, but not all people? And generally what they found is that in the year before it began, there was a physical trauma, a substantial physical trauma, like falling on your tailbone, which I did in 7th grade, and I broke the tip of my tailbone off. And so many of us have tailbone injuries. It's stunning. Or being in a car accident or breaking your leg, a big physical trauma. Or it can be a history of abuse and a history of physical abuse and or emotional abuse. And the example that I use is of a brand new puppy brought into a home. You got a happy new puppy coming in, tails wagging, running to everybody, super, super happy dog. But when nobody's looking, somebody in the family kicks the puppy. And the puppy kind of goes, what? And gets hurt. But he's still pretty happy, wagging his tail again within a minute or two. And then it gets kicked again. And 2 weeks later, that poor puppy who's now being kicked every day is no longer wagging its tail. That tail is between its leg and it doesn't know where to go because it's being hurt all the time. It's being threatened all the time. Or think about somebody who's being bullied in school. And I was bullied badly in school by a guy who raped and murdered my neighbor. So, if you are bullied and you walk every day, you have to walk into a situation where there's somebody who can hurt you physically, mentally, emotionally, you're in fight or flight. As soon as you get ready to go, you're in fight or flight. And that's a big risk factor, is physical trauma or emotional trauma. The great news here is we can turn it off. We know how to turn it off. It's about physical therapy for the parasympathetic nervous system. We have to turn the amygdala off and turn the parasympathetic nervous system on. And the way we do that is by stimulating our senses. Because that's your brain's job is to interpret everything, right? Your brain remembers everything that ever happened to you. And even now, you're talking to me, it's thinking about your history. Were you ever abused? Did you have a bully? You got all this stuff happening, right? And
Yes.
the brain is like a thunderstorm inside. It's like flash here, flash here, flash here, flash here. It's beautiful. The brain functioning is beautiful. We have to stop. We have to normalize that brain function again. The best way to do it is with our senses. So there's a fabulous technique called I Spy that works beautifully in turning off the sympathetic nervous system. So let's do it for everybody watching, because we still have people watching on Facebook, still have people watching on YouTube. Let's do I Spy. Our purpose here is to engage the parasympathetic nervous system and reduce that. So the first thing we're going to do is just look around your room and just look at something that kind of makes you happy. So for me, it's this beautiful glass sculpture that I have on my window, and just embrace it for, a couple seconds. Beautiful blue dragonfly. Okay, then breathe in for 3 and out for 3. Everybody watching, I want you to do it, because we've got like 50 people watching. Okay, the second thing now is close your eyes. What do you hear? Can you hear anything in the background besides me talking? So for me, I can hear my parents talking in the other room. Okay, now breathe. Breathe out. Okay. Take a moment, and what do you smell? Can you smell anything? Smell anything right now? And for me, it is my mint tea. Smells great. This is why aromatherapy helps, because you're engaging that sense and you're getting your brain to pay attention to that. Okay, in, out. Okay, now Now I want you to touch something around you. We're going to go for the sensation of touch. So pick something to touch. Just rub your hand over it. I'm going to grab my bladder here from my model. It's got a nice texture. So just rub it. Rub something. You're just rub something and just engage your senses. Engage your finger senses. Okay. In, out. Okay. Did I do taste yet? Can you taste anything right now? Can y'all taste anything? If you can, just live there for a minute. For me, it's mint tea. Tastes good. Okay, in, out. Okay, so now, we're forcing the brain. Just stay away from the crazy stuff, and let's just focus on real things that are happening at this very moment. Now we're going to take this to another level. If you could look at anything, what would you look at that would make you smile? What would you just love to look at right now? Always makes you happy when you look at it. And for me, it would be my lovely cat. Okay, so in, out, or a beautiful sunset. Okay, what could you smell that would make you smile? You just love the smell of it. And for me, it's hot cinnamon rolls or coconut. So just live there for a moment. God, it smells so good. Okay, in, out. What could we hear that would put a smile on our face and make us really happy? What could we hear right now? And for me, BTS Microcosmo song. I just love it. Play it all the time. Makes me happy. Or John Denver. Okay, in, out. What could we taste that would make us super happy? What could we taste? What taste? Maple syrup. Okay, in, out. Okay. What could we touch that would just bring joy to our lives? What could we touch? And it would be a hug, or, a child's hair, or your pet, right? Okay, in, out. Okay. Now, are you anxious right now? No. We've literally turned off the sympathetic nervous system. Parasympathetic nervous system is on. The challenge we have in daily life today, especially in the last year, the craziness of COVID and the craziness that's happened here in the United States, is that, man, you're in fight or flight every 10 minutes. You see an article about COVID, you see an article about protests, and our brain is stuck there. So we have to physically work to calm it down. And the great thing is that the research studies from Harvard Medical School are nothing short of astonishing. You can take somebody with acute PTSD and do these techniques with them, and the brain scan proves that their brain normalizes and functions normally. So mindfulness is the concept of paying attention to what's happening to you at this moment. It's not worrying about the past. It's not worrying about this future. It's about, what are you touching right now? What do you smell right now? What can we do right now to just kind of calm everything down? And I'm ecstatic about all the new research that's happened, because we couldn't explain up to this point why somebody had TMJ and IC and IBS and some of these other sensitivities. And yes, you and I were born with sensitivity. It is what it is, but at some point in time, we also suffered a trauma. And because of our sensitivity, that trauma kind of played a much bigger role than maybe it needed to be. And no shame, no blame. I spent my 20s wondering why I was being punished, thinking I was damaged goods, thinking that I was unlovable, thinking that I was unworthy of anything, and I'm feeling it was all my fault, that it was all my fault. And I was in a very dark place, extremely dark place. But then the research started happening that showed the family connection. And then the research that started happening that showed about the central nervous system sensitization. And then the research started happening that talked about cross sensitization. And you know what? Oh, holy hell, the elephant on my back disappeared. It's not my fault, and it's not your fault in any way, shape, or form. Does this kind of make sense?
Yeah.
I can see it by your face that you're a little misty. And I want you to hear from me, like right now, that none of this is your fault. It is all explainable. But I know that right now, everybody's giving big words at you, and you're thinking incurable, and you're thinking this, and you're thinking that, and you're thinking surgery. Stop that all. There's nothing about your case that's scary. You're not peeing blood. We're going to take the fear away from you right now, right? There's nothing to fear here. But now we have to follow the clues. And clue number 1 is you're sensitive, and that's great. You and I are going to save lives because we're going to smell the fire first. My sister is an award-winning winemaker because she can taste wine differently, just like you can taste what your husband ate that day. That is a gift, and we're going to look at that as a gift. It's freaky weird, right? It's freaky weird, but that's okay. It is what it is. And it's our job to protect our nervous system. We can't have chemicals in our home. We can't do oven cleaner. We can't do stuff like that. Buying furniture is a bitch right now because so much of it is sprayed. But we're going to manage that. That's fine. That's fine. That's not a problem. And now there are just a couple of missing questions for you. Do you have a long-term fungal infection? Absolutely, you could have one. You flare with sugar. So let's just get that checked out once and for all. Not your fault. Number 2, what the hell's going on with your muscles, if anything? If you go to physical therapy and your muscles are in good shape, great. We don't have to worry about that anymore. And then, last but not least, understand that as we get older, we do get a little bit more sensitive from the loss of estrogen. You are going through perimenopause, reverse puberty. Hello, reverse puberty. And it's a little chaotic. And you're going to cry more, and you're going to laugh more, and you're going to get angry more. And you're going to look at your face and go, what the hell just happened? I strongly encourage you to start doing facials. It feels wonderful. It feels absolutely wonderful. So I am extremely optimistic for you. I want you to carry hope in your heart. Let's just answer a few questions, and then we'll be on our way. How does that sound?
Good. Thank you so much.
Okay. Well, listen, I can tell you're misty, and I'm sorry for making you misty. I want you to feel better. I want you to feel optimistic. I want you to feel.
I do. At least I feel like I have some steps now, because it was just, it's just hard.
Understand too, the Canadian medical system, it does not serve pelvic pain patients well. And if there's any mystery at all, what province do you live in?
Saskatchewan.
Okay, so I will tell you that probably 75% of the patients that I work with from Canada do come to the US at least once to have a proper diagnostic workup. It is ironic that you guys are like 20 years behind. And your top doctor is Curtis Nickel. The US government pays him for his research. So look for anything by Curtis Nickel, read it. And I think that, he's a good leader. You can also participate in research studies if you wanted to, but you know, hun, you're not a typical IC patient. You're like me. And we're going to be fine. We're just going to do it together. Okay. Okay, hun. All right. Well, listen, I hope you will keep in touch. I would love to hear from you again. I would love to hear what they say about your pelvic floor. Let's see if that's screwed up in any way. Probably is.
I think it must be, yes.
Yeah,
It could be a piece of the factor there.
And also, too, if anxiety is more of an, I had huge anxiety disorder, but then I took a class that completely changed my life called Phobies. And I no longer have, as soon as I feel anxious, I nip it in the bud. So I even went through uterine cancer emergency surgery, never had a panic attack. So I'm going to leave you with the best anxiety management technique of all. Well, I'll leave you with this, and then we'll come back to the regular meeting. So that one of the challenges with anxiety is every time you have a negative thought, you get a shot of adrenaline in your bloodstream. And so it's like adrenaline, 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 adrenaline all day long. And there's so much of this irritating chemical in your bloodstream that it just triggers everything. Makes your heart race, all this sort of stuff. So the secret to controlling anxiety is to control adrenaline. So here's how they taught us. Whenever you have a negative thought, the first thing you do is just visualize a stop sign for a moment. Just stop it. Just like, oh my God, no, stop it. Just stop your brain for a moment. Okay. Then take a nice, slow, deep breath. In for 3 and out for 3. That deep breath is the most important piece of this puzzle because what it does is it turns off the adrenaline from the negative thought. So you have now just rendered that chemically neutral. So stop sign, deep breath. And then the third piece is you just got to remind yourself it's just a thought. It has no power. It's like, oh my God, Jill, you're not God. You can't predict the future. How arrogant can you be to think that you're going to lose power tomorrow? You're not God. Get a grip, right? So you have to have something you kind of say to yourself that just reminds you it's a thought. Okay. So 3 steps: stop sign, deep breath, and then say something to yourself. All right. Now, what they did, they taught us the technique and they sent us on our way, but they said, listen, the first 24 hours a day, you're going to be doing this a couple of times because you have no freaking clue that every single thought going through your brain right now is pretty negative. But we have one fundamental goal here. We're just trying to get rid of adrenaline in your bloodstream. That's our goal here. So, and they were right. Oh my God. When I actually paid attention, like literally every thought was a negative thought. Oh, I can't eat that. I'll have a flare. Oh, I don't want to do that. This will happen. No, I know I'll have to, I don't want to do that because I have to find a bathroom, All right. So I did it easily 100 times the first day. Second day, I did it half as much, 50 times. Third day, I did it like 10 times. By the end of the week, I was doing it once a day. And you know what was amazing is that I was calm because I had finally gotten rid of the adrenaline. And it was like night or day. And so the rule here is anytime you have a negative thought, stop sign, deep breath, minimize the thought. You're going to do it a ton. But I promise you, a week from now, you're going to be amazed at how much better you feel and more optimistic you feel and how encouraged you feel when we can just get rid of the damn adrenaline. Does that make sense?
It does, yeah.
All right. So for everybody watching, stop sign, deep breath, minimize the thought. I have a video on our website, Anxiety and IC. The course is called Phobies. And there you go. All righty. Okay, hon.
Thank you.
A big, 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 giant hug. And if you ever need to, if you ever want to reach out, my email's icnetwork@mac.com. If you do want to try to come to the US, most Canadian patients, if you're in the center of Canada, and I apologize, I don't exactly remember where Saskatchewan is. I apologize.
It's above like North Dakota. Kind of in the middle.
Okay, so most of the patients there would go see Ken Peters, who's just outside of Detroit. Master diagnostician, state-of-the-art women's center, excellent at assessing pelvic floor, excellent at assessing anything else that could be contributing to that. And at some point in time, if this keeps going, you know, you're worth seeing an expert. Seeing a national expert or an international expert could save you 10 years of wasted time because of the fairly poor Canadian system. Yeah. Okay. All right, you guys. Well, listen, big giant hug, big giant tab. Thank you to everybody who participated in Zoom. Arakmi, thank you. Raylene, thank you. Everybody else, Eric, thank you. I'm going to turn off Zoom and I'm going to come back to Facebook and YouTube. All right. All right. Thank you, hon. All right. Zoom is off. No, I don't want to update it right now. Please, God. No, I don't want to turn off my computer. Right, you guys. I know that was probably pretty overwhelming for her, and I apologize for that. But I really do want you to carry hope in your heart. This is why we do subtyping now. It would be a shame to spend 20 years doing bladder therapies only to discover in hindsight you had a syndrome or endometriosis or chronic overlapping pain conditions. We're getting so much better at finding the right treatment. Nobody's trying to make the treatment fit the patient anymore. Now we're trying to find the right treatment for that patient. And a one-size-fits-all treatment approach does not work for everybody. We got to understand your anatomy first. You are an anatomical mystery to be solved, right? Blaze says, hello. Hi, Blaze. Lisa says, Botox for bladder, pelvic floor. It can be in either place. Elise says, oh, wait. Okay, got that. Thank you. Blaze says, I just got Peora for my girlfriend. She has a difficult time taking big or pills, so I wanted to know if she can cut the pill in half. You know, hon, you need to send an email to the company, Natural Approach to Nutrition. I don't know. I take Peora. I've never had a problem swallowing it. How big is it? Hold on. Like, I have trouble swallowing calcium pills and like that, and I need to take calcium. Okay, so here's a Peora. It's about an inch. It's about an inch long. So Blaze, would you email info@naturalapproachnutrition.com, info@naturalapproachnutrition.com, and ask the manufacturer what they think about that. I just don't know. Okay. All right, let's go back to Facebook here. Oh, let's see. Mary says, grew up in a very stressful alcoholic household with violence, guns, even a narcissistic mother. I raised 2 brothers starting at age 11. I was parentified then. Yeah, girl. Lelena says, wow, this makes so much sense. Yeah, it does, doesn't it? Mary says, I had physical and emotional abuse, was bullied for years, and she became my professor in nursing school. Oh my God. And you had to put up with her all over again. So what the international conference said is that you can see observable changes in brain function to the negative in 20 days of bullying. And it takes 20 days of mind-body medicine to reverse that and start healing the brain again. And so you can just imagine now the long-term toll that bullying would say. Eve says, what's the therapy? It's called Phobies. It was an old class it was created by a surgeon with anxiety disorder for his son, who also had anxiety disorder. Phobies, Phobease. I don't think you can still get some of the old materials. But there are other programs now. What I liked about the Phobies program is that I always felt a sense of shame with my anxiety. You know, I know exactly why it happened. I know exactly why it happened. And that is that we had a kid in our neighborhood who, as he got older, was very mentally ill and ended up raping and murdering my neighbor, and trying to murder her boyfriend, who was almost killed. Living with that on a day-to-day basis, I lived with that for 9 years. before he ended up in jail, every single day, being afraid to leave my house for running into this guy took a terrible toll on me. And it's one reason why I haven't married, is because it has been very, very hard for me to trust men after going through that. I've come close, but it's hard to break through that trauma. And I was embarrassed by that. And it wasn't until I got help and started working with other victims, and in fact, the victims of the other people that were also abused by him. You know, when we have our reunions, we have our class reunions. We also have our little victim reunions, and I often wonder how my life would be different if I hadn't gone through that, because that for me is what triggered everything fundamentally. But I am profoundly sensitive anyway. But having gone through that process really messed me up. My brain got stuck in anxiety. But it's so nice to be able to approach the day and not be anxious. And I'm really not anymore. I mean, I know what to do. I know what to do now so I don't let the anxiety and the adrenaline get out of control. And the way this doctor explained basically the chemical sensitivity to adrenaline and the toll that adrenaline takes on our body in general was a really important piece for me. And once I really embraced that and started doing that, my world changed for the better. I can't begin to tell you how important it was. Christy says, I've been on Urabel for a few months and now have yeast infection. Urabel has helped me on so many levels, but I can't live with yeast infections. What would be a healthier alternative? I'm not aware of Urabel causing yeast infections. Hold on, let's look at it. Are you sure it's yeast? I mean, have they identified a fungus? Let me look here real quick. Hold on. Let's take a look at this. Common and rare side effects for Urabel. Let's just take a look at this real quick. Common side effects of Urabel: abnormal color of urine, blurred vision, decreased sweating. Infrequent side effects: skin rash. And then here's another list. These tend to have a less severe expression: increased need to urinate, constipation, decreased breast milk production, diarrhea, dilated pupils, dry mouth, indigestion, nausea, stomach cramps, vomiting. Rare side effects. Holy hell, there's a lot of rare side effects. Skin rash, abnormal heart rhythm, increased sodium in the blood, bloody urine. Oh, that's interesting. That's very interesting. So that means that Urabel is irritating the bladder to the point that it's causing blood. Confusion, decreased urine production, high phosphate in the blood, hives, increased calcium in the kidneys, crap, increased pressure in the eye, crap. Kidney failure, holy hell, low amount of calcium in the blood, orthostatic hypotension, seizures, trouble breathing. And here's more. If experienced, these have a less severe expression: pins and needles on the skin, oral tingling, bone pain, confusion, cramps, difficult urination, dizziness, drowsiness, excessive thirst, fever, fluid retention, gas, generalized weakness, headache, intense abdominal pain, itching, joint pain, low energy, memory loss, nausea, vomiting, holy moly, and weight gain. So there's nothing in here about yeast infections. So, yeast infections are now coming, let's see. I almost confused the two. Christy, how old are you? Because once you pass a certain age, you could end up having some bacterial vaginosis, because as we get older, specifically through perimenopause and menopause and postmenopause, your pH, well, there you go, hon, you're 47. You're 47. So things are going to be changing down there. Have you had a hysterectomy? Are you still having periods, or have you had a hysterectomy? I'm waiting for her to answer. I mean, like, I honestly would want to do a next. Okay. I would want, the first thing I would want is to prove it. I would want to know if you do have a yeast infection. And the best way to do that is with a next generation test, next generation urine test, but they can also do vaginal swabs. Will test for good bacteria, bad bacteria, and fungus. You're spotting now. So when you said no, are you still having periods, or have your periods stopped? Generally, as we go through perimenopause, what happens is the interval between periods gets shorter. So instead of every 28 days, sometimes it's like 21 days. Your periods are shorter. So instead of 5 days, they're like 2 or 3 days, but they tend to be more intense and much more crampy and painful. That's kind of what we see with things changing as we get older. So I would want to know what the quality and health of your skin is down there. Are you starting to get dry? Because if you're getting dry, then what we're going to see, you're going to be more vulnerable to infection, fungal infection, bacterial infection, viral infection. That would be number one. And then number two, so anyway, the quality and health of your skin matters in your vagina's ability to defend itself from candida. But the second thing I really would want to know, and she says she's having lighter, more frequent periods, is I would want them to identify the specific candida if you have candida, because Candida glabrata is one of many species, and it is becoming remarkably drug resistant. And so Candida glabrata does not, depending upon this, where you got it from, and the history of that specific strain, it doesn't respond to topical over-the-counter yeast medications like Monistat. They're usually many of the Candida infections are now completely drug resistant to over-the-counters.
You didn't turn on the washer.
Oh, did you turn it on? Are you sure?
I don't know if you put soap in it.
I'm pretty sure I did. Yeah, pretty sure I did. I was trying to get it done before the power went out, if the power went out. So anyway, getting back to Candida glabrata. Candida glabrata is a bitch to treat. I know this because I had a Candida glabrata infection for 2 years, about 15 years ago. And oh my God. I got it after doing antibiotics for 3 months, amoxicillin under the, or Augmentin under the Dr. Paul Fukuzato approach to IC, which we now know is ridiculous. But back then, that's what we did. And whenever I ate sugar, it flared. Anything with milk sugar in it, oh my God, the yeast growth was ridiculous. So at least the next generation test, Christy will be able to tell you if you do have a drug-resistant fungal infection. So that would be, I think, the thing I would do next. All right, let's go back to Facebook. Lorraine asked, has anybody gotten the vaccine yet and any flares? Lorraine, that was like the very first question we got 4 hours ago, 3.5 hours ago. And the answer is I've had nobody contact me or call me to report that they flared with the vaccine. We have a discussion string on the IC Network Facebook page about our COVID research study. And some people went in there and said they were very, very worried about having the vaccine. I think you have to understand, look at the data from that study, and what our study showing, we have 100 patients in that study now, probably more, is that about 75% of IC patients who get COVID report a worsening of their symptoms, in many cases very severe. Like I think 25% reported a severe bladder wall flare where their treatment stopped working while getting COVID. And the assumption here, although we don't have any data to support this, is, I mean, we don't have any proof. We know from research studies that live COVID has been found in the urine of patients in 14 different research studies. We also have studies now that prove that COVID can infect the kidneys itself, that we see a diminishment of kidney function for possibly two reasons. Number one, COVID actually living in the kidney and infecting the kidney, or number two, as the result of the long-term toll that COVID infection would take in the body, as well as hospitalization and potentially ventilator use. And so I guess the question is COVID actually infecting the bladder wall in some patients? And we don't know, but we just don't know. It's possible. So you can read that article. I have a lot of patient comments on that in terms of patients who participated in the study sharing how COVID affected their IC symptoms. I weigh the risk versus the benefits. Listen, I've been in remission with my bladder wall for a long time. My issue is dominantly my pelvic floor. I don't even want to risk that. And so I absolutely will be getting the vaccine when I can get it. Even if it gave me a flare for a couple of days, holy hell, I don't want to get COVID. I just don't. What a crazy world we're living in right now. Mary Jones says, oily bath products I won't use, they make me itch. That's probably because of estrogen atrophy. Just put a little bit of baking soda in your water and that should be fine. A quarter cup of baking soda in a big bathtub of water actually feels really good. That's what I do when I take a bath. Mary also says, my arms and legs shed a lot of skin, no matter the stuff I put on, even oils. I use CeraVe. I love CeraVe lotions. They're so good. And we get dry. I mean, if you got Sjogren's syndrome, if you got super dryness, or you're on medications that make you dry, yeah, your skin would definitely be dry like that. Mary says, what do I think of microgen testing? You know what? I like data, and I think it's good data. To be able to, the key point with next generation testing is it will identify everything in your urine, good bacteria, bad bacteria, and fungi. And now that we know that so many patients are flaring because they have an overgrowth of candida in their urine, microgen testing, next generation testing now is the future of urine testing. And there was a big lecture done by Curtis Nichol to the American Urology Association, in which he exactly said that. It is our future. The challenge with next generation testing is interpreting the data. Because urine is not sterile. We have a biome in our urine. There are good bacteria living in our urinary tract. There are bad bacteria potentially living in there. There's fungus and virus. This is very, very new. And they're still trying to identify what a healthy biome is, because our biome has been greatly influenced by our history, by the antibiotics that we took when we were kids or whatever, as well as the foods that we're eating, because so many foods are now, especially meats, have been changed by antibiotics. And so we probably as a species lost our urinary biome, our old urinary biome, back right when antibiotics were invented back in the 40s. There's only one population on this earth that has what they believe to be a normal untainted biome, and that is it's going to be indigenous people in Africa or in Latin America, maybe around the Amazon, where there's no interaction with Western medicine and where they're eating what they can catch. And even then, they're still going to be impacted by dioxins in the air, which is really tragic. So mankind has really fucked up our planet in many ways. Sorry for the language, but it is what it is. This is why I don't like things. I mean, I love this as a product, but I hate that we end up with this in the landfill. You know, we all got to take. I want to get my request to all these manufacturers is I'd like to get the supplements out of these one-time use bottles and into something that's recyclable. Imagine the billions of plastic bottles sitting in landfills. It's just shameful. Can atrophic vaginitis mimic IC? Yeah, sure. Listen, if the vagina is really, really irritated and screaming at you, those pain sensations are going to go up the nerves to the spinal cord, where the bladder nerves also exist, and they are actually shared. So then we get neural crosstalk. So we that will then irritate potentially the nerves to the bladder and the nerves to the bowel. It's absolutely possible. I know. I will say that with my candida infection that I had, that hurt more than anything else I have ever gone through. It hurt. A fungal infection in the bladder. Holy hell. The pain was insane as compared to a bacterial infection. So anyway, all right, guys. Well, listen, I mean, we've been doing this now for about 3 hours and 35 minutes. So let's just do a last call for questions. Last call for questions. Anybody have any last questions they'd like to ask? If you find these meetings helpful, please come on over to our website, the IC Network, and at least sign up for our free newsletter, because when you sign up for our free newsletter, you get our 40-page flare management guide. And I'm really respectful of your mailbox. I do all of those. I don't send out spam. I send out newsletters like once every 2 months. And so you can respect the fact that I don't sell anything. We don't. The only time I have ever strayed from that, and I sent mails to all of my customers, was when Lyris came out that was curing Hunner's lesions. And I sent out 30,000 letters to our membership to let them know about this Lyris treatment. And a couple of people were angry at me for doing that, but I was like, you know what, listen, if we have a chance of curing the worst patients, it was worth taking their stress. Mary says, thank you, Jill. Do you do consults? Yes, I do wellness coaching. You can sign up for wellness coaching in our shop all the time. Do it almost every day except on Mondays. I generally do my wellness coaching in the afternoons and evenings because I have elderly parents that take up my mornings. Where is it? Where is it? Here it is. I'm going to tell you right now, this was the latest issue of our magazine. This was our fall-winter issue. It's a double issue because we had fires and I couldn't get out my fall issue with the power out. This is dedicated to chronic overlapping pain conditions, and it is so good. The new data is nothing short of astonishing. There's so much more hope now than we've ever had before. Ever, ever, ever. And so if you struggle with IC, IBS, vulvodynia, TMJ, you've got to get this. So sign up to become a member. You can buy individual copies, but if you can sign up for a member, that helps us do these meetings. That's what keeps me here. Mary says, do you need a hydrodistension to see Hunner's lesions if it's done? No, not necessarily. They now have new cystoscopes called narrowband imaging. And so if you happen to have a doctor who has a narrowband imaging cystoscope, you will not need a hydrodistension. That will indeed identify a Hunner's lesion. That's best case scenario. It's just an expensive piece of equipment that a lot of doctors have not purchased. Most doctors have not purchased. All righty. All right, you guys, listen, I'm going to give you homework. Here's your homework. You will see me again. I will probably do a drop-in meeting. No, well, listen, they told us we're going to have heavy storms for the next 5 days, so probably won't be able to do a drop-in meeting this week. There are times when I do drop-in meetings on YouTube, and there are times when I do drop-in meetings on Facebook, not always at the same time, because I will do them late at night, like 11 o'clock at night, so I can catch patients in Australia and Asia. Sometimes I would do them early in the morning. So they're unscheduled. They're just drop in. So make sure if you're on Facebook that you subscribe to our our page. On YouTube, make sure you subscribe to our channel so you get the automatic notification. And better yet, do both. If you can do both, that would be great. I really need more followers on YouTube so that I can do more. I would like to be able to do more, but it's numbers driven. So, all right. Mary says, you can't see them on a regular one. No, you can't see Hunter's lesions on a regular cystoscope unless it's a massive giant lesion. All right. Okay, so here's your homework. For 15 minutes today, I need you to do something for your bladder, your pelvic floor. Do your pelvic floor exercises. Make good choices with your food. For 15 minutes a day, I need you to do something for your noggin hair. I need you to do something that will improve your knowledge on IC. So, get our magazine, read an article a day, whatever. Get that knowledge level up. I want you to be able to talk to doctors like I do. I don't want anybody to be able to push you around, right? And it begins with your knowledge level. For 15 minutes a day, I need you to do some mind-body medicine. Let's calm that brain down. So do your I Spy, do tapping, relaxation, something that will remind your body that it does not need to be anxious. We need to get out of fight or flight mode. We need to get back into normal functioning. Remember that pain that is accompanied by anxiety will be intensified. Pain that is accompanied by laughter will be minimized by your midbrain. So let's get that mind-body medicine going. Now we know why it's so important. And for 15 minutes a day, I need you to laugh. Come on now. Laughter is the best medicine of all. I don't want you sitting in your room with the drapes shut in your bed crying. For God's sake, open up the drapes, get up, take a shower, put some clothes on, and then watch some funny videos on YouTube. Or I was watching Bridgerton last night on Netflix. It was awesome. It's really, really good. So anyway, or read some books. Come on, just get some laughter in there again. We got to get you out of fight or flight. We got to get that anxiety calmed down, and we're just going to focus on one simple thing at a time, trying to rule out, number one, are your muscles involved? Is your bladder involved, etc. You get it. You know what I mean. All right, guys. If you need to get a hold of me, icnetwork@com. If I promise to send you something that you did not get, please send me an email. Because I know I've missed a couple of people in the last month or so. All right? Okay. I'll see you later. Be well. Hugs to everybody. All right, you guys. I will see you later. Have a good one. Bye, Donna, if you're still watching. Donna, if you're still there, go look at the front page of the IC Network. Part of it was inspired by you, my dear. See ya. You'll know what I mean.